Two sheriff's vehicles skidded to a stop outside Harlow Emergency Animal Hospital at 4:47 in the morning, light bars cutting through the dark like accusations. By the time the investigators pushed through the front doors, every staff member on the night shift had already stopped breathing normally. They came for one person, a quiet blonde nurse in a carbon fiber leg brace who hadn't even finished her intake charting yet. She didn't run, she didn't argue. She simply set her clipboard down on the counter and looked at the lead investigator with eyes that had seen things he couldn't imagine, and said, "I've been waiting for someone to finally show up." Before we get into what happened next, if this kind of story hits different for you, subscribe to the channel right now. Hit that like button and drop a comment telling me what city or country you're watching from. I want to see exactly how far this story travels. Every comment, every city, it means everything. Now, let's go. The call had come in around 4:20 a.m. Dispatch had routed it as a narcotics irregularity at a licensed veterinary emergency facility, the kind of call that usually meant a disgruntled employee or a clerical error that got flagged by an overnight audit. Standard stuff. Investigator Dorian Voss had worked 12 years in the Caldwell County Sheriff's Department and handled maybe 40 of these. Most of them dissolved within an hour once somebody pulled the right paperwork. This one felt different from the moment he stepped out of the car. Harlow Emergency Animal Hospital sat on the edge of Graymill, a mid-sized city in the valley between two highway corridors, the kind of town that had a Costco and a minor league baseball team and considered itself bigger than it was. The hospital was a serious operation, though. 3 floors, surgical suites, 24-hour ICU for critical animals. The kind of place that attracted staff who actually knew what they were doing. Voss had driven past it 100 times. He'd never had reason to go inside until tonight. His partner, Deputy Sarah Falcone, pulled the second vehicle alongside his and climbed out already studying her tablet. She was newer, 6 years on the job, sharp in a way that sometimes made her impatient, and she had the incident summary pulled up before he'd even straightened his jacket. "Controlled substance discrepancy," she said, reading while she walked. 11 units of ketamine marked as dispensed, no corresponding patient records, plus 2 partial vials of hydromorphone unaccounted for from the past 3 weeks. Who flagged it? Automated audit software. Regional Pharmacy Board gets a notification when the numbers don't reconcile past a certain threshold. They contacted the hospital director last night. He contacted us. Voss pushed through the front door. The lobby was quiet, but not empty. 2 pet owners in the waiting area with coats pulled around them, a gray tabby and a carrier, a yellow lab with a bandaged ear. The overnight reception staff had the particular stillness of people who'd been told something was happening, but not exactly what. A man in a pressed shirt and loosened tie was already walking toward them from the hallway. Hospital Director Garrett Ashby, according to the ID badge clipped to his breast pocket. Mid-50s, careful posture, the practiced composure of someone who managed crises for a living and was currently failing to manage this one. "Investigator Voss," he said, extending his hand, "thank you for coming quickly. I want to be clear that we are fully cooperating." "Appreciate that." Voss shook it once. "Who's the staff member on duty when the discrepancies occurred?" Ashby didn't hesitate. "Nurse Bennett, Claire Bennett. She's been here since 11. She's still on shift." "I want to talk to her." "Of course." Ashby gestured toward the corridor. "She's doing intake in the back." Voss followed him through a set of double doors into the working area of the hospital. The smell changed immediately, antiseptic and warm animal, and something underneath both of those that wasn't unpleasant exactly, just alive. Exam rooms lined both sides of the hall. A technician in scrubs glanced up from a computer terminal, then looked away. Another one didn't bother looking up at all. They found her in the second bay from the end. Claire Bennett was standing beside an exam table, filling out a patient chart by hand while a tech finished an IV line on a small mixed-breed dog that had been brought in for suspected toxin ingestion. She was maybe 34, 35. Blonde hair pulled back without ceremony. A set of blue scrubs that had clearly been washed so many times the color had softened to something closer to gray. And below her left knee, visible beneath the hem of her scrub pants where they'd been hemmed shorter on one side, a carbon fiber leg brace that ran from just below her knee to the top of her shoe. She moved with it without thinking about it, shifting her weight, turning, reaching, the way people move around old injuries when they've stopped expecting them to improve. She heard them come in. She didn't spin around or go rigid. She finished the notation she was writing, capped her pen, and turned to face them with a kind of deliberate unhurriedness that Voss immediately logged without understanding why. "Ms. Bennett," Ashby said, "these investigators need to speak with you." "I heard," she said. Not defensive, not performatively calm either, just present. Voss looked at her directly. "I'm Investigator Voss, Caldwell County Sheriff's Department. Are you familiar with the controlled substance logs for this facility?" "I manage them on my shifts, yes." "Then you're aware there's a discrepancy." "I'm aware I filed 3 separate incident reports about the dispensing software over the past month." She said it without heat. "If that's what you're referring to." Falcone looked up from her tablet. "What kind of incident reports?" "The software was double-logging dispensed units. A patient would receive a dose, the system would record it once at point of dispensing, and again when the return was processed. Created phantom records. I reported it to Director Ashby, to the pharmacy liaison, and to the system vendor directly." She paused. "I have copies of all 3. There was a beat of silence. Ashby's expression shifted by a fraction. Not guilt, exactly, but the particular discomfort of a man who had not remembered those reports until this moment. Voss made a note. "We'll need access to the medication vault." "Of course," Claire said, and she walked them to it. Oh. The next 2 hours were methodical and increasingly uncomfortable for almost everyone except Claire Bennett. Voss had expected, based on nothing more specific than instinct sharpened by 12 years of interviews, that the vault access would reveal something. A pattern. An absence where something should have been. An explanation that didn't quite fit. Instead, every cabinet was correctly labeled, every log was current, every count sheet was initialed in her handwriting on the night she'd worked, and in the handwriting of the evening supervisor on the night she hadn't. The discrepancies in the software didn't align with her scheduled hours any more consistently than they aligned with anyone else's. Falcone was thorough. She cross-referenced shift schedules against log timestamps, checked the physical counts against the digital records, pulled the access card data from the vault door. Claire stood to one side while this happened, not hovering, not retreating. She answered every question that was put to her with precision and without elaboration, which under different circumstances would have read as lawyerly. Under these circumstances, it was reading as someone who had done this before, not been investigated before necessarily, but been in rooms where precision was the only currency that mattered. At one point, Voss noticed her hand tremor. It was subtle. A slight instability when she was holding a printed form Falcone had handed her, a faint irregularity in her grip. He was watching her peripherally, the way you watch someone you're trying not to watch, and he clocked it as a tell. Nervous. Whatever composure she was projecting on the surface, the hands were giving something away. He filed it. He didn't say anything yet. The problem was that the more they dug, the less there was to find. By 6 in the morning, the day shift had started arriving. The lobby filled with the particular energy of people walking into a situation they hadn't been warned about. Technicians stopping short at the sight of sheriff's vehicles in the lot. A vet on his way to surgical prep, who had to be redirected by Ashby. A receptionist who heard the word investigation and immediately started texting someone. The night staff who'd been on with Claire were quiet in the way of people waiting for something to either happen or resolve. Word traveled fast in hospitals. It always did. By 6:30, the general shape of the situation had spread through the building. The nurse in the back was being investigated for drug theft. Nobody had said those exact words, but the shape of it was there, and people filled it in themselves. Voss came back out to the main corridor and found Claire at the nursing station, updating a patient chart on a computer terminal. She was still working. In the middle of everything, she was still doing her job. "You don't have to keep working," he said. It wasn't exactly an instruction. He wasn't sure what it was. "Mrs. Kowalski's retriever had surgery at 2 a.m., Claire said without looking up. "She's going to call at 7 to check on him. Somebody should have the chart updated before that happens." She hit save. "I'm not going anywhere, investigator. You're welcome to keep asking questions." One of the technicians nearby, a young woman, early 20s, the one who'd looked up and away when Voss first arrived, was now looking at Claire with an expression that was caught between admiration and unease, like she wanted to say something and couldn't figure out how to start. Voss turned back toward the vault room. Falcone was already at the door of the medication records storage room, pulling archived printouts. She filed those reports, Falcone said quietly when he came close. I found 2 of them in the system. She reported the double log error to Ashby on the 14th. He forwarded it to IT. IT marked it as under review. Nobody followed up. What about the 3rd? Vendor complaint system, external submission. I have to contact them directly to confirm, but the submission reference number she gave me checks out. Voss exhaled through his nose. So, she flagged it. 3 times. He looked through the glass partition toward where Claire was still at the nursing station, now taking a call. Speaking in a low voice, her face angled slightly away, one hand resting on the counter, with the kind of habitual steadiness of someone who'd trained herself not to let pain show when she needed to appear capable. The tremor in her hand. He thought about it again. Thought about the leg brace. Thought about the way she moved. Not awkwardly, not with the careful deliberateness of someone compensating. With the automatic efficiency of someone whose body had been retrained to function around damage. He'd seen that kind of movement before. He just hadn't placed it yet. At 7:45, Director Ashby called a brief staff meeting in the break room. He framed it as a transparency measure, keeping the team informed, preventing rumor. But the actual effect was the opposite. Standing in front of 12 staff members ranging from senior veterinarians to overnight kennel workers, he made the specific mistake of not naming the investigation as a software issue. He said instead that the department was reviewing processes and personnel, and that everyone should continue their work as normal while the inquiry is ongoing. Personnel. The word landed and sat there. 2 senior technicians exchanged a look. One of the vet assistants, a man named Patrick Dole, who had been at Harlow for 8 years and had never previously had an opinion about Claire Bennett one way or the other, started doing the math in the way bored people do. Who was on shift? What was missing? Who'd been pulled aside? He arrived at his conclusion within 3 minutes and spent the remainder of the meeting staring at his phone. By 8, 2 separate pet owners in the waiting room had been told, by a well-meaning receptionist trying to explain the unusual atmosphere, that there was a staff situation involving medications. Claire walked through the lobby on her way to check on a post-surgical patient in the ICU ward and felt the shift in the room like a change in air pressure. A woman with a rabbit in a carrier looked at her leg brace for slightly too long. A man in a fishing vest who'd been friendly with her the night before found something pressing to look at on his phone. She kept walking. The ICU was quieter. It always was. Dim lighting, the hum of monitors, the soft particular sounds of animals in various stages of recovery. She moved down the row of enclosures with the unhurried attention of someone whose focus didn't depend on how the morning was going around her. Checked temperatures, assessed hydration, adjusted a blanket around a post-op spaniel who'd gotten tangled in the monitoring leads. The overnight tech who was finishing his shift, a young man named Dev Sandhu, had been watching her from the end of the row. "Are you okay?" he said finally. She kept working. "I'm fine, Dev." "Because he stopped. "People are saying things." "People say things," she said. "It'll get sorted." "How are you so calm?" She was quiet for a moment, not the silence of someone who didn't have an answer, but the silence of someone deciding how much of the real one to give. She pulled the spaniel's blanket straight, checked the clip on the monitoring lead, and straightened up. "I've been in rooms where keeping calm was the only thing that kept people alive," she said. "This isn't one of those rooms. So it's fine." Dev stared at her. "What does that mean?" She almost smiled. "It means the dog is going to be okay, the chart is updated, and Mrs. Kowalski called at 7:03, and I spoke to her myself before you ask." She picked up the clipboard at the end of the enclosure. "Go home, Dev. You've been here 12 hours. He left. But he left looking at her the way people look at someone they realize they may have underestimated, which is a different expression than the one he'd been wearing when she walked in. At 90:20, Investigator Voss found her in the small staff kitchen, standing at the counter with a cup of coffee. She wasn't drinking, not hiding, not on her phone, just standing in the only room in the building where she didn't have a responsibility to be actively doing something. "Bennett," he said. She looked up. "I want to ask you something off the record." She set the cup down. "Go ahead." "The leg," he said. "How long?" It wasn't the question she'd been expecting. Her expression shifted. "Not much, but enough." 7 years, she said. "Combat?" A very long pause. That's a specific guess, investigator. The way you hold the clipboard, he said. You compensate from the shoulder, not the wrist. People with civilian injuries compensate from the wrist. Military-trained people go to the shoulder because that's what they're taught when they're carrying equipment in the field. He watched her. I did 2 tours. I recognized the adjustment. She looked at him for a moment with an expression he couldn't fully categorize, something between assessment and something older and more tired. I was a trauma nurse, she said, attached to a humanitarian medical unit overseas. 7 years ago, there was an explosion during an evacuation. I took damage to the knee, the tibia. I've had 4 surgeries, the brace is permanent. She said it the way you state a fact that has stopped hurting to say out loud, flatly, without asking for any particular response. Were you decorated? I was medically separated and sent home, she said. Whether that comes with a decoration depends on who's filling out the paperwork. She picked up her coffee. Is this relevant to the investigation? I don't know yet, he said honestly. She looked at him over the rim of the cup. The tremor in my hand isn't nerves, she said. It's nerve damage from the same incident. It comes and goes. It gets worse when I'm tired or cold or under sustained pressure. She met his eyes directly, which means it's probably pretty visible right now. Voss was quiet. I know what it looks like, she said. I've been in rooms before where I looked guilty because I looked uncomfortable. I'm used to it. She set the cup down and moved toward the door. But the reports are in the system, investigator. I filed them before any of this started. That's not something a person does if they're stealing. She walked out. He stood in the kitchen for a moment after she'd gone, his notebook open to a page that didn't have nearly enough written on it. By 10:30, the day had accumulated its own unpleasant momentum. Director Ashby had made a second mistake, this one larger than the first. He'd called a brief meeting with the senior veterinary staff, without Claire present, to update them on the situation. The meeting was less than 12 minutes long. What came out of it wasn't anything Ashby said explicitly. It was the question someone asked at the end, and the fact that Ashby didn't immediately correct the assumption embedded in it. Should we be reviewing her other recent shifts? Ashby said he would look into it. He should have said, the evidence points to a software failure, not individual theft. He should have said, she filed 3 reports before any of this was flagged. He said neither of those things. He said he'd look into it, and a room full of senior staff walked out with the understanding that the investigation was pointing somewhere specific. Voss found out about the meeting from Falcone, who'd overheard it from the hallway. He found Ashby in his office 10 minutes later and did not have a pleasant conversation with him. But the damage was done, the kind of damage that moves faster than corrections do. At 11:15, Claire was pulled from patient rounds by a senior veterinarian, Dr. Warren Stahl, who told her with visible discomfort that, given the current circumstances, it might be better if she stepped back from direct patient care until the situation was resolved. He didn't use the word suspended. He didn't use the word investigation. He used the phrase stepped back 3 times in 90 seconds, which was its own answer to every question she hadn't asked. She didn't argue. She asked him to document the request in writing. He blinked. That probably isn't necessary. Document it in writing, she said again quietly, or I stay on the floor. He documented it. She walked to the break room. She sat down. She pulled out her phone, opened the saved email folder she'd been maintaining since the first time she'd reported the software issue, and spent 11 minutes adding a new entry with the time, date, and exact phrasing of what Warren Stahl had just told her. Then she sat with her hands flat on the table and breathed evenly in the specific way she had learned in a field medical training program during a situation that had nothing to do with this hospital, in a country that was not this one, in circumstances that had left her with a permanent brace and nerve damage, and the unshakable habit of documenting everything. At 11:47, the front doors of Harlow Emergency Animal Hospital opened. A large German shepherd walked in. He walked in ahead of his handler, not because he'd been released, but because his handler, a man in civilian clothes with a military-grade K9 vest in his hand, hadn't been able to hold him back. The dog moved through the lobby with the particular purposefulness of an animal that had been somewhere before and had just remembered where it was. Past the reception desk, past the waiting area. Through the double doors that a bewildered receptionist had instinctively opened because the dog's expression had not left room for another option. Down the hall. into the break room. The German Shepherd, older now, muzzle going gray, moving with the slight stiffness of a working dog past his prime, stopped in front of Claire Bennett. He looked at her for exactly 1 second, and then he lowered his head and pressed it, gently and with unmistakable intention, against her injured leg. The room, which had contained 2 other nurses and a technician eating a very early lunch, went completely silent. Claire looked down at him. Something crossed her face. Not surprise. Not quite. More like recognition arriving through a wall she'd built to stop exactly this kind of thing from getting through. She put her hand on the back of his neck. "Hey," she said softly. "Hey, I know. Easy." The handler appeared in the doorway, slightly out of breath, holding the vest. He was tall, mid-40s, former military written in every line of how he stood. He stared at his dog. Then he stared at Claire. Behind him, visible through the hallway, was a second man, shorter, broader, wearing a jacket with a unit patch on the shoulder that Voss, who had now appeared at the corridor junction, recognized from 2 tours he'd done a decade ago. The dog hadn't moved. He was still pressing his graying head against Claire Bennett's leg, and she was still holding the back of his neck, and neither of them looked like they were planning to stop any time soon. Director Ashby appeared somewhere behind Voss and said, in a voice that had lost most of its confidence, "Who are these people?" The man with the unit patch looked at him. Then he looked at Claire. Then he looked at the dog, who by this point had also placed one large paw on Claire's shoe with the quiet authority of an animal that had made a decision and intended to stand by it. "My name is Commander Bryce Calloway," the man said. "Special Operations K9 Command." He looked back at Ashby. "And I think," he said slowly, "you and I need to have a very different conversation than the one you thought you were going to have this morning." Ashby opened his mouth and closed it again, which was becoming a habit he hadn't had 24 hours ago. Commander Bryce Calloway didn't wait for him to find words. He stepped fully into the break room, glancing once at the dog, still planted against Claire's leg, still not moving, and then at the 2 nurses and the technician who were frozen at the table with their lunches going cold in front of them. One look from Calloway and all 3 of them found somewhere else to be inside of about 15 seconds. He didn't say anything. He didn't have to. There was a quality to how he occupied a room that made optional presences feel suddenly optional. Investigator Voss stayed. Falcone appeared at the doorway behind Ashby, tablet in hand, reading the situation with the alert attention of someone who'd just realized the morning had changed shape entirely. The handler, the man who'd come in with Calloway, the one who'd lost the battle of getting the dog to stop, stepped to the side of the door and said nothing. He was watching Claire with an expression that Voss couldn't interpret cleanly. Not recognition, exactly. More like someone looking at a detail in a photograph they'd been studying for years and finally understanding what they were actually seeing. "Commander," Ashby started, "I'm not sure what brings you here, but—" "Sit down," Calloway said. Not loudly. He said it the way people say things when they have never once in their professional life needed to repeat themselves. Ashby sat down. Calloway pulled out the chair across from Claire and sat too, which somehow made him more authoritative rather than less. He put his forearms on the table. He looked at her. Not the way Voss had been looking at her all morning, measuring and cataloging, but with something more direct than that, something that had the texture of an old debt. "You look worse than the last time I saw you," he said. "I've been on shift since 11 last night and under investigation since 5 a.m., Claire said. "So that tracks." "Fair." He glanced at the dog. "He found you faster than I did." "He always did have better instincts." Voss looked at the dog again. The German Shepherd. And he could see now how old the animal was, 7 or 8 years at least. The kind of age that put visible wear into the joints of working dogs. Hadn't lifted his head from Claire's leg. His eyes were half closed. His breathing was slow and even. He looked like an animal that had been running towards something for a long time and had finally stopped. "Investigator," Calloway said, turning to Voss. "What's the current status of your investigation?" Voss looked at him steadily. "That's not information I'm obligated to share with—" "Bryce Calloway, Special Operations K9 Command, active federal contractor status, clearance level you'd need to make a phone call to verify." He said it without arrogance, just accuracy. "I'm not here to interfere with a county investigation. I'm here because 12 hours ago I got a notification that an individual on a federal witness cooperation list had been flagged in a regional law enforcement system. He looked at Claire. Which led me here. The room was very quiet. Voss said carefully, "She's on a federal witness cooperation list." "She's on a federal witness cooperation list," Calloway confirmed. "Has been for 6 years. It's not related to anything criminal. It relates to a debriefing she participated in after an overseas incident that resulted in significant damage to her and 2 members of my unit." He paused. "The system flags her name automatically when she appears in law enforcement contacts. Protective measure." Ashby was staring. He'd forgotten, apparently, that his mouth was open. "What incident?" Voss said. Calloway looked at Claire. A question that was actually a question, not a prompt. She shook her head slightly. Not refusing, just indicating he should use his judgment about how much. 7 years ago, Calloway said, my unit was running a personnel extraction in a region I'm not going to name because I don't have to. There was an explosion during the secondary extraction phase. We had a handler down, a K-9 down, and no medical personnel within viable response range. He looked at the dog. Except her. She was attached to the humanitarian unit operating in the adjacent sector. She got to them first. She stabilized the handler under active risk conditions, kept the K-9 alive long enough for us to get him to a field station, and she took the blast damage that would have finished both of them. He let that sit for a moment. When she was medevaced out, we didn't know her name. She'd been operating under unit designation protocols. By the time the handler was coherent enough to give us a description, she was already stateside going into her first surgery. Falcone had stopped typing on her tablet. Voss looked at Claire. The humanitarian unit designation. I wasn't supposed to be in that sector, Claire said evenly. I'd gone off route to respond to a secondary call. By the time the explosion happened, I was technically outside my assigned operational area. She paused. That's part of why the paperwork on my end was complicated. Complicated, Voss repeated. I was separated from service for operating outside my designated zone during a critical incident, she said. The fact that operating outside my designated zone is what allowed me to reach the casualties in time was noted in the debrief. It did not change the separation status. She said it without bitterness. Just facts. I came home, I had surgeries, I went to nursing school, I got a job. That's the whole story. It wasn't the whole story. Voss could tell that from the way Calloway's jaw had tightened slightly when she described her separation. But it was the version she'd decided to give, and she gave it cleanly, and he noted the difference without pushing on it. The dog's name, Calloway explained, was Recon. He'd been the K-9 in the explosion. He'd retired from active service 18 months after the incident, the damage to his left rear leg making field deployment no longer viable. He'd been with his handler since, the handler being the quiet man at the door, whose name was Staff Sergeant Marcus Webb, now civilian contracted to the unit as a trainer. Recon was 8 years old. He had a service record that included 4 deployments, 2 commendations, and 1 incident report that Calloway had read approximately 30 times and still found difficult to get through. He was also, as of this morning, in the lobby of an emergency animal hospital because he'd been brought in for evaluation of a recurring joint issue in that same rear leg, and because the closest qualified veterinary facility with a K-9 unit contract was Harlow Emergency Animal Hospital in Graymill. Nobody had known Claire Bennett worked there. Nobody had told Recon either, but Recon had figured it out himself within approximately 40 seconds of walking through the front door. The smell, probably. Or something more than smell. The particular combination of scent and sound and something animals track that humans don't have language for. He'd pulled the lead clean out of Webb's hand, and that had been that. Does he do that often? Falcone said, looking at the dog. Just decide. He's retired, Webb said from the door. It was the first thing he'd said since coming in. His voice was lower than expected, unhurried. He does what he wants now. Within reason, Calloway said. He went through 2 sets of double doors and past the reception desk, Webb said. That's outside reason. That's a personal decision. Despite everything, the investigation, the morning, the 12 hours on her feet, and the nerve damage climbing her left leg, Claire laughed. It was short and a little rough, the laugh of someone who hadn't laughed in a while and had temporarily forgotten they knew how. Recon's tail moved twice at the sound of it. Voss watched all of this. He watched Calloway's expression when Claire laughed. He watched Webb's shoulders drop a fraction. He watched Ashby sitting in the corner of the room, looking like a man who was only beginning to understand the scope of the error he'd been building toward all morning. "Investigator," Calloway said, bringing things back. "Where does the investigation stand?" "We're waiting on a vendor confirmation for a software complaint filed by Ms. Bennett in—" "Bennett," Claire said, "in late last month." Voss looked at her. "The complaint reference number checks out in our system. The vendor hasn't responded yet." "How long does that take?" "Depends on their response time. Could be—" "I can have a federal contractor request in front of their compliance department in 20 minutes, Calloway said. "Response time becomes a different conversation when it's federal." Voss looked at him for a long moment. He'd had people try to leverage federal authority in the middle of county investigations before. It rarely made things better and usually made things worse. But Calloway wasn't leveraging. He was making an offer and leaving it on the table. There was a difference. "I'll make the call myself," Voss said, "but I'll make it now." He stepped out. Falcone followed him. And Garrett Ashby, who had been very quiet for an unusual amount of time, cleared his throat. "Commander Calloway," he started, "I want to assure you that our cooperation with the investigation has been—" "Mr. Ashby," Calloway said, "I read the incident report she filed. The software complaint from the 14th, the follow-up on the 21st, the vendor submission on the 2nd. I have them pulled up on my phone right now." He set the phone on the table, face up. "How many of those did you personally escalate after she brought them to you?" Ashby looked at the phone. "It was handling. IT marked it under review. That's not escalation. That's filing." Calloway's voice hadn't changed in volume or temperature at all, which made it worse. "She told you the system was creating phantom records. She told you twice before the audit flagged it. And this morning you called in law enforcement before you called the software vendor." He picked up the phone. "I'm not a county investigator. I'm not here to tell you how to run your facility. But I will tell you that the woman sitting across from me held a dying soldier and a dying dog together with her bare hands in a situation that would have ended most people. And she did it because it was the right thing to do, and she never once asked for recognition for it." He stood up. "Whatever conversation you have with Investigator Voss, I'd encourage you to have it honestly." He walked out. Webb stayed at the door a moment. He was looking at Claire again with that same expression, the one Voss had first clocked and couldn't categorize. Now, without Calloway's presence filling the room, it was easier to see what it actually was. It was grief. The specific kind that comes from finding out, too late, that something you lost was something you could have found. "I didn't know it was you," he said. "For 6 years. I didn't know your name." Claire looked at him. The humor from a minute ago was gone. Something quieter and more complicated had taken its place. "I know," she said. "Recon," Webb said, almost to himself. "He knew before I did." He glanced at the dog. "He's been, since we brought him in for the leg, he gets anxious. Clinics make him anxious. He was doing fine until about 30 seconds after we came through the door, and then he stopped. He just knew." "Dogs remember differently than we do," Claire said. "Smell doesn't degrade the same way memory does. He's been carrying it this whole time." She looked down at Recon, who had not moved. "So have you, I think." Webb was quiet for a long moment. "Are you okay?" he said finally. "With all of this—" He gestured vaguely at the room, the building, everything the morning had assembled around her. "Not particularly," she said, "but I've been less okay in worse places." He almost said something else. Then he didn't. He gave her one short nod and walked out after Calloway. The vendor call took 37 minutes. Voss made it from Ashby's office, with Ashby present and Falcone on a second line taking notes. The software company's compliance department, which had apparently been expecting a general inquiry call and received instead a county investigator with a federal contractor follow-up reference number, became significantly more organized in their record-keeping within about 4 minutes of the call beginning. What they confirmed, in language that grew progressively less qualified as the call went on. Their dispensing integration software had contained a known error in the reconciliation module, known to their internal QA team since approximately 5 weeks prior, flagged by a small number of client facilities since then, and not yet resolved due to a backlog in their patch deployment schedule. The error caused duplicate logging under specific conditions that matched exactly the dispensing pattern at Harlow Emergency Animal Hospital over the past 3 weeks. The compliance director on the call said the words, We acknowledge the error originated with our software twice, which was 2 more times than Voss had expected, and then said they had email documentation of a client complaint filed from Harlow on the 2nd of the month that had been routed to the wrong internal queue and not actioned. Claire's third report, the one nobody had responded to. Falcone made a noise that wasn't quite a word and wrote something on her tablet in letters large enough that Voss could read it from where he was sitting. She was right. All 3 times. He already knew. But seeing it written out in Falcone's block capitals in the middle of Ashby's office, while Ashby sat 2 feet away looking at the middle distance, did something specific to the temperature of the room. The call ended. Voss sat with the phone in his hand for a moment. "The investigation into Ms. Bennett," he said without looking at Ashby, "is closed." Ashby said nothing. "The software vendor will be providing written confirmation within the hour. I'll need a copy of all 3 of her incident reports, the IT escalation record, and the timestamps on every decision made this morning, starting from when you received the audit notification last night." Voss stood up. "I'm also going to need a list of everyone present at the staff meeting you held at 7:45, and documentation of what was said. That was it was a meeting during an active investigation in which information about a subject was communicated to staff without verification of the evidence basis for that information." He picked up his jacket, "which I'll be noting in my report." Ashby's face had the look of a man doing calculations about consequences in real time and not liking the results. Voss walked out of the office and went to find Claire. She was in the ICU again. Not hiding. There was no pretense that this was hiding. But the ICU was the room she'd returned to twice now when things got too much, and Voss understood why. It was quiet. It smelled like antiseptic and warm animal and something grounding. The monitors made regular sounds. The animals in recovery needed attention in a way that was simple and answerable, unlike everything else happening around her. She was adjusting the position of a post-surgical cat when he came in, and she finished the adjustment before she turned. "The vendor confirmed the software error," he said. "Their own QA team had flagged the same issue internally. Your complaints were valid, and they acknowledged the error originated with their platform." She looked at him. Something in her face moved. Not relief exactly, more like the particular exhaustion of being right, when being right has already cost you everything it was going to cost. "Okay," she said. "The investigation into you is closed, formally. I'll have documentation by end of day." "Okay." He waited. "That's it? What do you want me to say?" "I don't know," he said. "Most people in your situation would what?" She turned back to the cat, checking the incision site with the automatic attention of someone whose hands knew what to do even when the rest of her was elsewhere. "Get angry? Cry? Tell you what a terrible morning it's been?" She adjusted the monitoring lead. "I know it's been a terrible morning, investigator. I've been inside it." She looked at him over her shoulder. "But being right about the software doesn't unring the bell. The staff meeting already happened. The waiting room already heard the word medication. The people who decided what I was before they looked at the evidence already decided. Ashby will be required to address that." "Ashby will send an email," she said, "which is not the same thing." She straightened. "I'm not angry at you. You did your job. You asked the right questions, you followed the evidence, and when the evidence pointed away from me, you followed it there too. That's what this is supposed to look like." She looked at him directly. "I'm just tired. I've been tired for 7 years, and today was a specific kind of on top of it." Voss looked at her for a moment. He thought about what Calloway had said in the break room, held a dying soldier and a dying dog with her bare hands, and thought about how it fit with what he was looking at, which was a woman in gray-blue scrubs and a permanent leg brace who'd been on her feet since 11 the previous night and had just spent 6 hours being quietly investigated while continuing to chart patient records and check on recovering animals. "The hand tremor," he said. "Nerve damage, from the same incident." She moved the clipboard to her other arm. "I told you." "I know, He stopped, started again. "I noted it as a potential indicator of concealment. This morning. Early." He met her eyes. "I was wrong about that." "You were doing your job." "I was making an assumption," he said. "There's a difference." She looked at him for a moment. "Yes?" she said. "There is." That was all. She didn't offer him absolution he hadn't earned, and she didn't make it harder than that either. She just said, "Yes, there is," and let it stand. The shift changed at noon. The incoming staff walked into a building that felt different from the one they'd left the night before, pressurized in a way that didn't entirely make sense, the corridors carrying the particular residue of a morning that had gone wrong in several directions. People asked questions. The people who'd been there gave answers that varied in accuracy and detail, depending on who was doing the giving. What spread through the building over the next hour was not precisely the truth. It was close to the truth, closer than what had been spreading 6 hours earlier, but it had the distortions that all passed along information accumulates. Some people heard that the investigation had been dropped. Some people heard that the software was at fault. Some people heard that a military officer had come in and made a scene, which was not accurate but had the emotional correctness of things that feel true even when they aren't quite. Patrick Dole, who had done his math in the staff meeting and arrived at the wrong answer, spent 20 uncomfortable minutes in the break room processing the updated information before deciding he needed to be somewhere else. Dr. Warren Stahl, who had asked Claire to step back from patient care and then not adequately documented the request when she'd insisted, sent Falcone a written summary of the conversation without being asked. Voss read it later and made a note about it. In the ICU, Claire kept working. Calloway came and found her at 1:15. He had a coffee, 2 coffees actually, one of which he handed to her without asking whether she wanted it. She took it. "Recon's appointment," he said. "We still need to get his leg looked at." "I know. I'll arrange it." She drank the coffee. "Who's the vet he usually works with?" "We've been working with a facility outside Hartfield, but the drive's getting long with his joint issue. We need someone closer." He paused. "Ideally, someone who understands working dogs." "I can talk to Dr. Ewan. She's our canine specialist. She'd be good with him." "Good." He sat on the edge of the counter, which was not a thing most people did in the ICU, but Calloway had the physical ease of someone who'd spent too much time in field conditions to be constrained by room conventions. "How are you doing?" "You just asked me that 20 minutes ago." 20 minutes is a long time." She looked at him. "I'm standing," she said. "That's not the same as okay. I know." She wrapped both hands around the coffee cup, which was warm and helped with the nerve pain a little. "Not a lot." "Enough." "Did you know," she said, "that when I applied for this job, I left the military service section blank on the application? Not because I was hiding it, because I figured it would raise questions about the leg and the separation, and I'd spend the interview explaining what happened instead of demonstrating what I could do." "And they hired me," she said. "Warren Stahl interviewed me. He asked me 3 questions about patient monitoring protocols, watched me do a pressure dressing on a practice wound, and said I was the best candidate he'd seen in 2 years. She paused. "Today, he asked me to step back from the floor." Calloway was quiet. "I'm not saying he's a bad person," she said. "He saw something that looked like trouble, and he managed it the way administrators manage things. I understand it." She drank the coffee. "It still feels like something." "What does it feel like?" "Like being separated all over again," she said. "Which is, I know that's not a fair comparison, but the architecture of it is the same. You do the thing correctly, you get the outcome wrong, and someone with authority makes a decision about your status based on the outcome instead of the process." She paused. "And you come home and you have surgeries and you get a job and you think, okay, that's behind me. And then one morning, it's not." Calloway looked at her for a long moment. "I owe you something," he said. "You don't. We didn't fight hard enough for your record after the debrief. The separation was, there were options. There were people who could have pushed back on the zone violation finding. Nobody pushed." His voice had the flatness of someone saying something they've said to themselves many times in a smaller, quieter venue. "I've thought about that." "So have I," she said. "But I made a life. I'm fine." "You've been under investigation for narcotics theft for the last 8 hours." "I've been through worse." He almost argued with that. Then he didn't, because he knew it was true, and because some things don't benefit from being argued. Through the glass wall of the ICU, they could see Webb sitting in the corridor with Recon at his feet. The dog's head was up, turned toward the ICU, tracking Claire's position through glass with the same patient attention he'd maintained all morning. Webb had his phone out but wasn't looking at it. "He told you about not knowing it was you," Calloway said. "Yes." He looked for years. The humanitarian unit records from that sector were heavily redacted. There was a name on the initial medic contact form, but it had been filed under your unit designation, and the records office cross-referenced it wrong. He paused. He found out your name 6 weeks ago. I found out you were working in Gray Mill 3 weeks ago. He looked at her. We were going to reach out. We hadn't figured out how. Recon figured it out, she said. Recon always figures it out. He looked at the dog through the glass. He's been different since the leg started acting up. More anxious. I think he knows his operational days are done, and he doesn't know what to do with that. He glanced back at her. He knew what to do when he walked in here. Claire looked at Recon through the glass. The dog looked back at her. His tail moved once, slowly. I can make time to see him, she said. Not just for the appointment, if it helps him. It'll help him, Calloway said. I think it'll help Webb too, honestly. She nodded. She turned back to the ICU, to the row of recovering animals, and the monitors, and the work that needed doing. She had the coffee in one hand and the clipboard in the other, and her leg hurt from standing since the previous night, and the morning had been a specific kind of terrible that she was going to have to sit with for a while before she could put it somewhere manageable. But the investigation was closed. The software vendor had acknowledged the error. Voss had said, in the kitchen 6 hours ago, that he'd recognized the shoulder compensation from 2 tours, and he'd been wrong about the tremor, and he'd said so without being asked. She was still standing. It wasn't everything, but it was enough to keep going on. At 1:47, Investigator Voss came back through the ICU doors. He wasn't alone. Behind him was a woman in a regional pharmacy board jacket, and behind her, a man Claire had never seen before. 50s, gray at the temples, a Caldwell County Administrative ID badge, and the expression of someone who'd driven very fast from somewhere and hadn't been happy about any of it. The man looked at Calloway. Then he looked at Claire. He had a folder in his hand, thick with printed documents, and he was gripping it with both hands in the way of someone delivering something they'd rather not be delivering. Voss stopped next to Claire. This is Deputy Director Holt, he said, Regional Oversight for the Pharmacy Board. He drove from the district office this morning. Claire looked at Deputy Director Holt. Okay, she said. Holt opened the folder. He took a breath. We've received the vendor's written acknowledgement of the software defect, he said. We've also reviewed the 3 incident reports filed by you between the 14th and 2nd of last month. He looked up. The investigation into controlled substance irregularities at this facility has been formally closed, with all findings attributed to third-party software malfunction. Your professional record will reflect no adverse findings. He paused. I need to inform you that per standard board protocol, the facility director will be required to complete a formal accountability review for failure to escalate documented staff complaints prior to initiating a law enforcement referral. He said it as if he was reading from a script, which he partly was. Thank you, Claire said. Holt looked at her for a moment with the slightly uncomfortable expression of a man who'd expected a bigger reaction and wasn't sure what to do with the absence of one. He closed the folder. He handed it to Voss. He nodded once at Claire and walked out. The pharmacy board woman followed him. Voss stayed. It's in writing, he said. Copies will go to the facility, to your personnel file, and to the pharmacy board record. He paused. I'd recommend you retain your own copy. I will, she said. He nodded. He looked like he wanted to say something else. He didn't say it. He turned to go. Investigator. He stopped. The shoulder compensation, she said. You were right. I trained for 3 years to move normally with the damage, and I've been told by 4 different physical therapists that it's invisible. She paused. It wasn't invisible to you. I wasn't looking for it specifically, he said. It was just familiar. I know. She looked at him. Thank you for following the evidence. He gave her one short nod. He walked out. Calloway was quiet for a moment. Then he said, For what it's worth, I think he's going to remember this case. I think so too, she said. She turned back to the monitors. She had 3 animals to reassess before the afternoon rounds, a chart to update, and a conversation to have with Dr. Ewan about Recon's joint evaluation. She had a personnel file that now contained a formal clearance. She had nerve pain from the knee to the ankle, and she'd been awake for 15 hours and the morning had taken more out of her than she was going to admit to anyone in this building. She had also the memory of Recon's gray muzzle pressed against her leg, the specific weight and warmth of it, the way his tail had moved when she spoke. 7 years of not knowing whether either of them had made it, condensed into that one moment in the break room. She would deal with the rest of the morning later. She would deal with Stahl and Ashby and the whispers that had moved through the building and the way certain people had looked at her and then looked away. She would deal with all of it in the deliberate and unhurried way she dealt with things that couldn't be rushed. Later. Right now there was a post-surgical cat that needed its incision reassessed, and a shepherd in the corridor who kept tracking her through glass, and she was still standing, and that was enough. At 2:12 her phone buzzed. She looked at the screen. It was a message from a number she didn't recognize. Gray Mill area code, no name in her contacts. She opened it. "This is Marcus Webb. Recon won't eat. He's done this before when something's wrong, but I don't know what's wrong. He ate fine this morning, and now he won't touch the bowl. His rear leg is also worse than this morning. He's not weight-bearing on it at all now." She read it twice. Then she looked through the glass at the corridor where Webb was sitting. The corridor was empty. Webb and Recon were gone. She was already moving toward the door when the text came through. The second one, 3 minutes after the first, that made her stop in the middle of the ICU with her hand on the door and her heart doing something she didn't have medical language for. "We're in the parking lot. He collapsed on the way to the car. He can't get up." She was through the ICU door before she'd finished reading the second message. The corridor was empty in the way corridors get when something has just happened in them. A chair pushed back at a wrong angle, a coffee cup left on the floor beside where Webb had been sitting. Claire moved fast, not running because running with the brace on tile was a fall waiting to happen, but moving with the efficient, controlled speed of someone who'd learned to cover ground quickly without the luxury of 2 functional legs. She hit the double doors at the end of the hall with her shoulder and pushed through into the lobby, scanning as she went. The receptionist at the front desk started to say something. Claire pointed at the door. "Get Dr. Ewan. K9, parking lot, collapse. Tell her I need a gurney and a portable ultrasound." She didn't wait to see if the woman moved. She went through the front doors. The parking lot was half full. Late morning turnover, a mix of staff vehicles and client cars. She found Webb 40 feet from the entrance, crouched over Recon on the asphalt. The dog was on his side. His breathing was visible from 20 feet away. Too fast, shallow, the kind of rapid shallow that had a specific list of causes, and none of them were minor. Webb had his hand on Recon's ribcage and was talking to him in a low, continuous voice, the kind of voice you use when you need someone to stay with you, and you're not sure they will. Calloway was there too, standing 2 feet back with his phone already out. He looked up when Claire came through the doors, and something in his posture shifted. Not relief, but the specific change of someone who'd been holding a situation together alone and just had backup arrive. Claire dropped to one knee beside Recon. The impact on the asphalt sent a jolt up through the brace and into the damaged joint, and she registered it and set it aside. She put her hands on Recon's abdomen first, not the chest, the abdomen, and pressed, careful, checking for the distension that would tell her what she already suspected. It was there. Not dramatic yet, but there. "How long since he ate?" she said. "This morning," Webb said. 7:30. Normal amount." "What did he eat?" "His regular food, same as always." "Did he eat fast?" "Faster than usual?" Webb thought about it. "Maybe. He's been anxious today. The drive, the clinic smell. He might have eaten faster." Claire's hands moved to Recon's gums. She pressed, checked capillary refill. Slower than it should be. She looked at his eyes, glazed, but tracking her, still tracking her. "He's got gastric distension," she said. "Possibly early GDV. We need imaging now to know if it's twisted." Webb's face did something complicated. He knew enough about working dogs to know what GDV meant. He'd known dogs that hadn't survived it. "Can you—" "Yes," she said, "but we have to move him right now." She looked up at Calloway. "I need 2 people to carry him. You can't let him walk, and you can't compress his abdomen. Support the chest and hindquarters. Keep him flat. Do you have anyone?" "I've got it." Calloway was already moving, phone to his ear. "I've got someone in the car." From the front entrance of this building, Dr. Nadia Ewan came through the doors at a controlled run, a vet tech behind her with the portable ultrasound on a cart, and a second tech with a gurney adapted for large animals. Ewan was small and fast, mid-40s, with the focused economy of movement that came from 20 years of emergency veterinary work. She assessed Recon in about 4 seconds and looked at Claire. "GDV?" Suspected. No radiograph yet, but the abdominal palpation is positive and his refill time is slow. Blood pressure? I don't have equipment out here. Get him inside. Ewan looked at the text. Gurney, now. Flat transfer. The next 3 minutes were controlled chaos with the volume turned down. The kind of emergency that runs on training instead of noise. Calloway and a third man. Claire hadn't seen before. Broad-shouldered, moving with the automatic precision of someone who'd carried injured personnel before, lifted Recon onto the gurney with the practiced efficiency of people who didn't need to be told twice about no abdominal compression. Webb kept his hand on Recon's neck the whole time, walking alongside, still talking to him. They got him through the doors. In the surgical prep area, Ewan had the portable ultrasound running in under 2 minutes. Claire stayed because nobody told her to leave and because she knew what she was looking at when the image came up on the screen, and Ewan needed someone who could confirm the read without second-guessing. The stomach was rotated. Not catastrophically. Not yet. But it had moved. The pylorus had shifted. They were looking at a GDV that had progressed past the distension phase and into torsion, which meant the clock had changed. He needs surgery, Ewan said. It wasn't a question. Yes, Claire said. Webb was at the edge of the prep area. He'd heard. His face was very still. What are the odds? Ewan looked at him directly. She was the kind of doctor who didn't soften that particular question. If we go in the next 30 minutes, good. If we wait, they drop fast. She was already pulling her surgical gloves. I need consent to proceed. Yes, Webb said. Do it. It's going to be at least 2 hours. Possibly 3. Ewan glanced at a tech. Get him on fluids, start the gastric decompression. I want a full panel before I open. She looked at Claire. You staying? It was a real question. Claire was off the floor, technically. Stahl's request, the one she'd made him document, was still in effect. She was cleared of the investigation, but not formally reinstated to active duty status, which was an administrative distinction that Ewan was asking her to weigh. I'm staying, Claire said. Ewan nodded once and turned to her team. What? The surgery prep took 22 minutes. Recon was sedated carefully. Working dogs with joint issues sometimes had sensitivities to standard anesthetic protocols, and Ewan went conservative on the induction dose, titrating up, watching his response. He went under without complication, which was the first thing that had gone cleanly all day. Webb sat in the corridor outside the surgical suite. Calloway sat with him for a while and then excused himself to make calls. There were unit protocols when a contracted K9 went into emergency surgery, paperwork, and notifications and logistics that didn't stop because the situation was emotional. He came back 40 minutes later looking like a man who'd handled the logistics and would now have to handle the rest of it. In the surgical suite, Ewan worked and Claire assisted, which was technically outside her scope as a veterinary nurse, but nobody in that room was going to argue about scope during a GDV repair on a retired military working dog. She handled instrument passes, retraction, monitored vitals, called out pressure changes. The stomach was repositioned. The pylorus was unrotated. Ewan checked for necrotic tissue, found a small section of the fundus that had compromised, excised it, closed. The gastropexy sutures went in to prevent recurrence. The whole procedure ran 2 hours and 11 minutes. The dog didn't code. He came close. 40 minutes in, his pressure dropped and stayed dropped for about 90 seconds while Ewan worked faster than Claire had seen her work yet, hands moving with the specific speed of someone who understood that 90 seconds was all the time there was. He stabilized. His pressure came back. The monitors evened out. Claire realized when things steadied that she'd been holding her breath for somewhere between 30 and 90 seconds and couldn't have said exactly when she'd started. Ewan sutured the final layer without speaking. When she was done, she stood back, stripped her outer gloves, and looked at the monitors for a full 10 seconds before she said anything. He should recover, she said, barring infection or secondary complications. She looked at Claire. Good catch on the timing. 10 more minutes and we'd be having a different conversation. Claire looked at Recon, so sedated, breathing steadily, monitors regular, and felt something unclench in her chest that she hadn't registered as clenched until it let go. He found me this morning, she said. It wasn't really an explanation. It was just what came out. Ewan looked at her. She'd heard, presumably, some version of the morning. The investigation, the commander, the dog that had walked through 2 sets of double doors. She'd been in the building for most of it. I heard, she said. Yeah. She pulled her surgical cap off. Go tell his handler he's stable. Webb was still in the corridor. He'd been there for 2 hours and 11 minutes without moving more than a few feet. He was on his feet the moment the suite door opened, and whatever composure he'd been maintaining through the wait showed its seams when he saw Claire's face, because he didn't know yet what expression she was wearing. He's stable, she said. Webb closed his eyes, opened them. He exhaled through his mouth, the long, controlled exhale of someone releasing pressure they'd been holding in a specific and practiced way. He's going to recover, she said. Dr. Ewan will talk you through the post-op protocol. He'll need to stay here at least 48 hours. After that, recovery at home with restrictions. Okay, Webb said. His voice was not entirely steady. He was lucky, she said. The timing was lucky. Webb looked at her. You caught it in the parking lot. I palpated his abdomen. The distension was already present. I'd been sitting with him for 10 minutes, Webb said. He stopped. I didn't catch it. You're not a veterinary nurse, she said. You knew something was wrong and you texted me. That's what mattered. He was quiet for a moment. Calloway had appeared at the end of the corridor and was coming toward them, reading the situation from Claire's posture, his own shoulders coming down slightly. You should know something, Webb said. He said it like he'd decided to say it before she could find a reason to leave. After the incident, after you were medevaced, I was coherent enough to give a description to the debrief team at the field station about 36 hours later. He paused. They asked me to describe the medic who responded. I told them everything I could remember. What you looked like, how you moved, what you said. He looked at her. They asked if there was anything else, any other identifier. She waited. I told them the medic had a specific injury, he said. Pre-existing. Not a blast wound. The way she moved, the way she compensated. It wasn't from the explosion. I told them to look for someone with a prior leg injury. Claire looked at him. They never found you, he said, but that's what I told them. He paused. I want you to know I tried, for whatever it's worth after 7 years. She looked at him for a long moment. There were several things she could say to that. There were things that would be gracious, and things that would be honest, and things that would be both. And she was tired enough and raw enough from the morning that the version she landed on was simply, I know you did. Thank you. He nodded. He didn't say anything else. He turned to Calloway, who had reached them, and the two of them exchanged the particular look of people who've been through enough together to conduct whole conversations without words. Claire walked back toward the main floor. It was 3:40 in the afternoon when Dr. Warren Stahl found her at the nursing station. He looked like a man who'd been rehearsing something, which he had been. Claire could see it in the careful arrangement of his posture, the way he'd come in from the far side of the station instead of the direct route, giving himself a few extra seconds. Claire, he said. She kept her eyes on the chart she was updating. Warren. I owe you an apology. He said it cleanly. To his credit, he didn't attach qualifications to it immediately. The request this morning, asking you to step back, I should have had more information before I made that call. She finished the notation she was writing. You had the information I'd given you. You chose to interpret the situation differently. I did, he said. That was wrong. She looked up. Stahl was in his late 50s, a competent surgeon and a mediocre administrator, the kind of doctor who did excellent work with animals and consistently underestimated the complexity of the people around him. He wasn't a bad person. He'd made a bad decision. She knew the difference, even when she was tired and the difference was thin. Your written documentation request is still in the system, she said. I'm going to keep it. He looked slightly pained. I understand. It's not retaliation, she said. It's a record, in case the question of this morning's timeline comes up in the pharmacy board review. She paused. Having a documented sequence of who made what decisions and when is going to matter. He was quiet for a moment. Yes, he said. I suppose it will. Is there anything else? He stopped. I spoke to Garrett. He's drafting a statement to the full staff about the investigation outcome. He's going to address the staff meeting he held this morning. Good. I think he's also... Stahl paused. There may be consequences from the board review. For the facility. For him, specifically. That's between him and the board, Claire said. She turned back to the chart. Stahl stood there for another moment, not because he had more to say, but because he hadn't gotten whatever he'd needed from the conversation. She understood what he'd needed. He'd needed her to accept the apology in a way that made them even, that reset the morning back to the state of before. She wasn't going to do that, not because she was punishing him, but because it wasn't possible. Things that happened didn't unhappen because someone said sorry, and she was too tired to perform the kind of gracious forgiveness that made other people feel better at her expense. He left. She updated the chart. She moved to the next one. At 4:15, Investigator Voss came back through the building. Not an official visit. He'd already filed what he needed to file, and the investigation was formally closed. He came in through the front and asked the receptionist if Claire Bennett was still on the floor. She was. He found her in the recovery area, checking on a dog that had come out of orthopedic surgery an hour earlier. He stood at the door for a moment before she noticed him. "I thought you'd have gone home by now," he said. "My shift ends at 7, she said. "I have 3 hours." He looked at her. 15 hours on. Leg brace. Nerve damage that got worse with prolonged standing. 3 more hours. "You don't have to—" "The dog needs his post-op monitoring," she said. She wasn't being difficult. She was just stating the situation as it was. "I'm the one who has his chart." Voss came into the room. He leaned against the wall, which was not how he usually stood, arms crossed, watching. It was a different posture, less investigator, more something else. "The pharmacy board sent their preliminary findings to the county office," he said. "Standard procedure. They copy regional law enforcement when a facility review is initiated." He paused. "The findings include notation of the 3 incident reports and the timeline of how each one was handled, or not handled." "I know," she said. "Ashby is facing a mandatory review. They have a formal process for directors who initiate law enforcement referrals without first exhausting internal remediation steps." He paused. "It's not a small thing." "No," she said. "It isn't. The board may also look at the facility's general oversight protocol, depending on what they find in the IT escalation records." He was watching her. "How are you feeling about that?" She thought about it honestly. Not how she was supposed to feel, not the clean answer, the real one. "I don't want Garrett Ashby to lose his career," she said. "He made bad decisions this morning, and he made them fast without thinking them through, and people got hurt by them. Me, specifically." She adjusted the monitoring lead on the dog. "But he's not a corrupt person. He's someone who panicked and made choices I'd have made differently." She paused. "I want the process to be correct. I want the record to be accurate. Whether that costs him his position, that's for the board to decide." Voss looked at her for a long moment. "That's a remarkably measured thing to say." "I've had a long time to learn how to be measured," she said. "It doesn't come naturally." "No?" "No." She checked the dog's temperature. "My first instinct this morning when Warren Stahl asked me to step back was to put the documentation request in writing and then quit." She said it plainly. "Leave the chart, walk out the door, take the clearance letter and the apology, and go somewhere they didn't know my name." "Why didn't you?" She glanced over at him. "Because the dog in Bay 3 needed his post-op vitals checked," she said, "and because I'm not going to let one bad morning rewrite what I've built here." She paused. "And because quitting is what they would have assumed I'd do if they'd thought about it, and I've spent too long proving assumptions wrong to start validating them now." Voss was quiet for a moment. Then, "The shoulder compensation," he said. "What you said earlier, that 4 physical therapists told you it was invisible." "It is, to most people." "I wasn't looking for it," he said again. "I want to be clear about that. I wasn't looking for military background indicators. I was just—" "I know," she said. "You were paying attention." "Right." "Most people don't," she said. "Pay attention. They see the brace and they make an assessment and they stop looking." She looked at him. "You kept looking." "I'm an investigator." "You're good at it," she said. "The wrong conclusion, but a good process." She almost smiled. "I've seen worse." He left at 4:30. The building was quieter now, mid-afternoon lull before the evening rush. The air felt different from this morning, Or maybe she was just reading it differently now that the weight of the investigation was off her. At 5, Calloway came to find her again. I was carrying his jacket and had the look of a man who'd completed all the logistics he'd needed to complete and was now dealing with the part that couldn't be systematized. Recon's awake, he said, he asking for you and the way he asks for things. I'll go see him in a few minutes. He's not distressed, Calloway said. He keeps looking at the door. He paused. Webb's in there with him. I think Webb's taking it harder than Recon at this point. Webb's been through harder, she said. I know. That's not a comfort. She finished what she was doing. She walked with Calloway to the recovery ward where Recon was being monitored post-surgery, and she stood at the door for a second before she went in. Recon's head came up immediately when she walked in. He couldn't do much else. He was on a soft surface, IV line in place, the incision site wrapped. But his head came up and he watched her cross the room with the same focused attention he'd had in the break room that morning, 10 hours and a lifetime ago. She sat on the edge of the recovery surface, careful of the IV line, and put her hand on his neck the same way she had then. Hey, she said, you gave us a scare. His tail moved, twice. Webb was sitting in the chair on the other side, elbows on his knees, looking at the dog with an expression that had given up pretending to be anything other than what it was. He's going to need different food, Claire said. Lower volume, higher frequency. No more large meals. We'll talk through the post-op diet before you take him home. She kept her hand on Recon's neck. And no more fast eating. I can show you a slow feeder technique. Okay, Webb said. He should be fine, she said. He's going to be fine. I know, Webb said. He stopped. He rubbed his face with one hand. He's been with me since he was 14 months old, 7 years. He looked at the dog. You spend that kind of time with something and you forget that it's finite. Everything's finite, she said. I know that too. He paused. Doesn't help. No, she said. It doesn't. They were quiet for a while. The monitors were steady. Recon's breathing was even. He hadn't taken his eyes off Claire since she'd walked in, which Calloway, leaning in the doorway, observed with the particular expression of a man who'd seen a lot of things and was filing this one somewhere separate. At 5:43, Claire's phone buzzed. She glanced at the screen. Unknown number. Different area code this time. Not Graymill. A long-distance prefix she didn't immediately recognize. The message was short. This is Lieutenant Colonel Diane Ferris, Inspector General's office, 3rd Medical Command. I need to speak with you at your earliest convenience regarding a formal inquiry related to your military separation record. The matter is time-sensitive. Please call this number directly. Claire read it twice. She read it a third time. Her hand, the one that wasn't on Recon's neck, was very still on her thigh. The nerve damage that ran from her knee to her ankle had been flaring for the last 2 hours. A dull, insistent current that she'd been managing with the same practiced non-attention she applied to most things she couldn't fix. She stopped managing it for a moment. She let herself feel it, the damage, the permanence of it, the 7 years of surgeries and physical therapy and learning to move differently and building a life in the space of what was left. Then she put her phone in her pocket. I have to make a call, she said to no one in particular. She stood up, careful, and walked to the door. Calloway was still in the doorway. He'd seen her face when she read the message. She could tell from the way he shifted that he'd clocked the change. She stepped past him into the corridor. She stood with her back against the wall, phone in her hand, looking at the number for a long moment. Inspector General's office, 3rd Medical Command, her separation record. 7 years of time-sensitive packed into 14 words from a stranger. She pressed call. It rang once, twice. On the third ring, a woman picked up, clear, professional, with the specific economy of someone who answered phones in official capacities and had done it for a long time. Lieutenant Colonel Ferris. This is Claire Bennett, she said. You messaged me. A pause, then, Ms. Bennett, thank you for calling quickly. Another pause, the kind with something behind it. I'm going to need to ask you a few questions about the incident report filed under your service designation 7 years ago regarding an overseas extraction event. Her voice was careful, measured. Specifically, I need to know whether you were ever formally notified of a secondary inquiry into that incident. Claire's grip on the phone was very still. What secondary inquiry? She said. Silence on the line. Then, Ms. Bennett, No one ever told you. It wasn't a question. The way she said it, the specific weight of it, landed in Claire's chest like something had shifted under the floor. Told me what? She said. The corridor was empty, and the fluorescent light above her was doing the thing fluorescent lights do in hospitals at the end of long days. A faint, irregular flicker that nobody ever fixed because there was always something more urgent. Claire stood with her back against the wall, and her phone pressed to her ear, and waited for Lieutenant Colonel Ferris to say the next thing. "Ms. Bennett," Ferris said, and her voice had changed. Not softer exactly, but more careful, the way voices get when delivering information that should have been delivered a long time ago and wasn't. 6 years ago, 14 months after your medical separation, an internal review board within 3rd Medical Command conducted a secondary assessment of the incident report associated with your service designation. A pause. The review was initiated by a complaint filed by a senior officer in your unit. The complaint alleged that the zone violation finding in your separation record was incorrectly applied given the documented circumstances of the extraction event. Claire said nothing. Her hand was flat against the wall behind her. The review board concluded, Ferris continued, that the zone violation determination had been made without full consideration of the operational timeline, specifically the secondary distress call you were responding to when you entered the adjacent sector. They found that under the rules of engagement applicable to your unit's humanitarian designation, your movement was defensible and arguably consistent with your standing orders. Another pause. They recommended the zone violation finding be struck from your separation record and that your separation be reclassified from a disciplinary action to a medical separation, full honors. The light above her flickered once. That recommendation, Claire said carefully, was never communicated to me. No, Ferris said. It wasn't. Why? A long pause, the kind that contained an answer that was going to be uncomfortable to give. The recommendation was submitted to the Personnel Command Office for processing, Ferris said. Standard procedure. It should have triggered a formal notification to you within 90 days. She paused. The notification was not sent. We have been conducting an administrative audit over the past 4 months, and the gap was identified 3 weeks ago. I have been attempting to locate you since then. 3 weeks. 3 weeks while Claire had been filing incident reports about dispensing software errors and working night shifts and managing nerve pain and building the life she'd built in the space of what the separation had left her. Who, Claire said, was the senior officer who filed the complaint? That information is part of the formal review record, Ferris said. I can share it when we meet in person, which I'd like to do as soon as possible. There are documents that need your signature and a correction process that requires your direct participation. Tell me who filed it, Claire said. A pause. Then, the complaint was filed by a Commander Bryce Calloway, Special Operations K-9 Command. She closed her eyes, opened them. Down the corridor, 20 feet away, Calloway was still leaning in the doorway of the recovery room with his arms crossed, looking at his phone. He hadn't heard. He didn't know she was on this call or what was being said into her ear at this moment. He'd filed a complaint on her behalf 14 months after the incident. He'd never told her. For 6 years, he'd never said a word about it. Ms. Bennett, Ferris said, are you still there? Yes, she said. I'm here. I understand this is... When can we meet? Claire said. She didn't go back into the recovery room immediately. She stood in the corridor for 4 minutes, which felt like a shorter time than it was, and she let the information reorganize itself inside her. Not the emotional weight of it, not yet, but the practical shape. A review board had found in her favor. 6 years ago. The correction had been ordered and then lost somewhere in a personnel command office that had failed to send a notification to a woman recovering from her 4th surgery in a suburb of a city she'd moved to specifically because nobody there knew her name. 6 years. She thought about the application she'd filled out for this job, the one where she'd left the military service section blank. She thought about the 4 physical therapists. She thought about Warren Stahl saying, I think it might be better if you stepped back, and herself making him document it in writing. Then she walked back to the recovery room. Calloway looked up when she came through the door. He read her face the way he read most things, quickly and mostly accurately, and something in his expression shifted. What happened? He said. She looked at him for a moment. Webb was still in the chair beside Recon, and Recon was still watching Claire, and the monitors were still steady. She didn't want to do this in front of Webb, but she wasn't going to ask Calloway to step out because whatever his reaction was going to be, she wasn't sure she wanted to manage it in a closed corridor. "I just spoke with a Lieutenant Colonel Ferris," she said. "Inspector General's office, 3rd Medical Command." Calloway went very still. "She told me about the review board," Claire said. "The one from 6 years ago." The stillness lasted another second. Then he exhaled, not a sigh, more like a pressure release, and looked at the floor briefly before looking back at her. "I should have told you," he said, "when I found out you were here. I should have led with it." "Yes," she said. "You should have." "I didn't know it hadn't been processed," he said. "I filed the complaint and I submitted the documentation and I followed up twice in the first year and both times I was told it was in process." His jaw was tight. "After that I assumed it had been handled. I assumed you'd been notified." He looked at her directly. "I'm sorry. That's not... I should have confirmed directly with you. I assumed." "You assumed," she said. "I know." She was quiet for a moment. Webb had looked up from recon but wasn't saying anything. He was doing the thing people did when they'd walked into the edge of someone else's significant conversation, keeping very still and taking up as little space as possible. 6 years, she said. Not an accusation, just the number. "I know," Calloway said again. He didn't try to attach anything to it. He just let it stand as the thing it was. She nodded once. "I'm meeting with Ferris," she said as soon as possible. "There are documents." She paused. "The zone violation finding is going to be struck from my record. The separation is going to be reclassified." Something moved through Calloway's face that was too complicated to name in a single word. "It should have happened years ago," he said. "Yes," she said. "It should have." She looked at Recon. The dog was still watching her. His tail moved once when her eyes met his, the same 2-beat movement it had made every time she'd acknowledged him today. "He filed a complaint for you," Webb said quietly. He hadn't been able to stay entirely outside the conversation after all. "For what it's worth, he argued with people above his pay grade to make it happen. I was there for part of it." He paused. "He just should have told you." "He should have told me," Claire said. She looked at Calloway. "But thank you for filing it." She paused. "Even if the system managed to lose it for 6 years." "The system," Calloway said with a dryness that briefly cut through the weight of the moment, "has never been the strong point." At 6:20, Garrett Ashby sent an email to the full staff of Harlow Emergency Animal Hospital. Claire read it on her phone at the nursing station while she finished her last set of evening charts. It was 3 paragraphs. The first acknowledged the investigation and its outcome. The second stated, in language that was carefully but unambiguously worded, that the controlled substance discrepancies had been attributed entirely to third-party software malfunction and that no staff member had engaged in misconduct of any kind. The third paragraph was the one that cost him something to write. She could tell from the construction of it, the way it circled before it landed, and it said that the facility had failed to act on documented staff complaints in a timely manner, that this failure had contributed to an unnecessary and harmful investigation of a staff member, and that the facility would be implementing revised escalation protocols for all equipment and software complaints effective immediately. It didn't say her name. She wasn't sure whether the absence of her name was a legal protection or a personal one, and she didn't spend time deciding. The email said what it needed to say. It would go into the record. It was something. Patrick Dole read the email in the staff parking lot on his way to his car and sat in the driver's seat for 10 minutes before starting the engine. He'd been at Harlow for 8 years, long enough to have seen investigations come and go, long enough to have watched how quickly people filled in blanks they hadn't been given. He'd filled in blanks this morning. He'd done the math in the staff meeting and arrived at a wrong answer, and then spent 6 hours operating on that answer without questioning it. The email was direct enough that there was no version of reading it that allowed him to feel comfortable about that. He started his car and drove home and spent the evening being slightly worse company than usual, which his wife noticed but didn't push on, because she knew that look and knew it meant he was working something out that he'd tell her about eventually. At 6:45, Investigator Voss received a copy of Ashby's email forwarded by Falcone with the single annotation, "Read the third paragraph." He read it. He forwarded it to the county administrative office with a note that the facility's acknowledgement of process failure was documented and should be included in the pharmacy board review file. He did it methodically, without satisfaction, the way he did most things. But he did it. At 7, Claire's shift ended. She didn't leave immediately. She updated the final chart, checked on recon one last time, stable, resting, Webb still in the chair beside him, with a cup of vending machine coffee and the particular exhaustion of someone who'd been running on adrenaline for 8 hours and had finally hit empty. And then she walked to her locker, changed out of her scrubs, and sat on the bench with her street clothes on and her hands flat on her thighs, and did nothing for approximately 6 minutes. Her knee hurt. Her ankle hurt. The nerve damage was doing the low-grade electrical hum it did at the end of long shifts, the kind that wasn't sharp enough to be unbearable and wasn't mild enough to ignore. She'd been on her feet for 20 hours. She had the formal clearance. She had the email. She had a phone call from an inspector general's officer that was going to change the shape of 6 years of her history. She was very, very tired. She put on her jacket and walked out. The next morning arrived with the particular quality of mornings after hard days. Not fresh exactly, but emptied of the specific pressure that the previous day had held. Claire slept 6 hours, which was less than she needed and more than she'd expected, and woke to 3 messages on her phone that told her the day was already in motion without her. The first was from Ferris, confirming a meeting location, the Regional Military Administrative Office in Kellerton, 40 minutes from Gray Mill, 2 days out. The second was from Callaway. Recon had a good night, ate a small meal at WOS 600. Ewan says he can go home in 48 hours. Then, after a gap in the timestamp, I should have done more to confirm you'd been notified. I'm going to have to live with that. The third was from a number she didn't recognize with a local Gray Mill area code. And it took her a moment to understand what she was reading because the name at the top wasn't one she'd expected to see in her messages. It was from Dorian Voss. Ms. Bennett, not official contact, just informational. The pharmacy board completed their preliminary findings overnight. Forwarding what I can. The board has identified 3 separate procedural failures in how your complaints were handled. Ashby is facing a formal accountability review and mandatory remediation. The software vendor is being referred for a compliance audit. One more thing. The board's notation of your complaint timeline is going to the Regional Veterinary Nursing Association as a case study in documentation best practices. Your name is in it. If you consent, let me know. She read it twice. Then she put the phone down on the kitchen table and made coffee. The case study. She thought about that. Her incident reports, her timestamps, her insistence on documentation, becoming the example of what good process looked like. There was something almost funny about it, in the specific way that things are funny when they're also heavy. She consented. She texted Voss back 3 words. Yes. Thank you. The pharmacy board review meeting at Harlow was scheduled for 2 days later, and it was not a quiet event. The board sent 2 representatives, a senior compliance officer named Marshall Vick, and a documentation specialist whose name Claire didn't catch. And they arrived at 9 in the morning with a folder that was thick enough to have its own gravitational pull. Ashby was present. Dr. Stahl was present. The IT director, a man named Pete Garland, who had received Claire's first software complaint on the 14th and marked it under review and then done nothing for 3 weeks, was present and looked like a man who understood his morning was going to be worse than he'd prepared for. Voss was there as an observer. Falcone was with him. Callaway, who had no formal role in a pharmacy board proceeding but had a federal contractor status that made his presence difficult to object to, was sitting in a chair by the window with his arms crossed, saying nothing. Claire was there because the board had specifically requested her presence as the staff member whose complaints formed the basis of the review. Marshall Vick opened the meeting without ceremony. We're here to conduct a formal accountability review of events preceding and surrounding the controlled substance investigation at this facility on the morning of the 14th. He laid documents on the table as he spoke. We have reviewed 3 incident reports filed by Nurse Bennett. We have reviewed the IT escalation record. We have reviewed the vendor complaint submission and the vendor's written acknowledgement of software defect. And we have reviewed the internal staff communications from the morning of the investigation. He looked up. We have questions for Director Ashby, for IT Director Garland, and for the facility's pharmacy liaison. We'll take them in that order. He started with Garland. Pete Garland was 43 years old and had been in IT administration for 17 years. and had never once sat in a room where his decision to mark something as under review had become the centerpiece of a formal compliance proceeding. He answered the first question: why had the complaint from the 14th not been escalated, with the explanation that the software issue had seemed minor at the time and had been placed in the standard queue. Standard queue resolution time, Vic said, reading from his document, is documented in your facility protocol as 72 hours for non-critical issues. He looked up. The complaint sat in the queue for 22 days before the automated audit flagged the same issue. There was a backlog, Garland said. There was a second complaint on the 21st, Vic said. 1 week later. What happened to that one? Garland was quiet for a moment. It should have triggered an escalation flag. It should have, Vic agreed. Did it? There was a... The escalation flag system was... Garland stopped. No, he said. It didn't. Because the escalation flag system was also malfunctioning, Vic said, which is in the vendor's acknowledgement letter. He paused. Did anyone test the escalation flag system? The silence that followed was the specific silence of a man who knew the answer was no and was spending approximately 3 seconds deciding whether there was a version of no that was less damaging than another. There wasn't. No, Garland said. Vic wrote something. He moved on. Ashby's portion of the review was longer. He'd prepared. Claire could tell from the folder he'd brought, the notes in the margins of the documents he had laid out in front of him. And his preparation made certain things clearer rather than less, because the board's questions went to places his preparation hadn't anticipated. You received the first complaint on the 14th, Vic said. You forwarded it to IT. Correct. You received the second complaint on the 21st. Yes. What action did you take on the second complaint? Ashby looked at his notes. I followed up with IT to confirm it was being handled. Verbally or in writing? A pause. Verbally. Is there a record of that communication? Another pause. No. So the record shows, Vic said carefully, that you received the second complaint and took no documented action. I spoke with undocumented verbal communication does not constitute documented action under your facility's complaint escalation protocol. Vic said it without particular heat, just precision. You received 2 complaints from the same staff member about the same issue over 7 days. The protocol for recurring complaints of the same nature specifies written escalation to the pharmacy liaison and the software vendor within 48 hours of the second report. He looked at Ashby. That did not happen. Ashby's folder was not helping him the way he'd hoped it would. Claire sat across the table and watched this happen with the attention of someone who'd been in enough procedural settings to understand what was unfolding. Ashby wasn't being destroyed, not in the dramatic sense, not with raised voices or direct accusations. He was being precisely and methodically held against his own facility's protocols and found to have fallen short of them. It was in some ways worse than the dramatic version. The dramatic version would have allowed him to push back, to frame himself as a victim of the process, to find angles. This version left no angles. It was just the record, and the record was what it was. Voss watched from the side of the room. Falcone took notes. Calloway didn't move from his chair. At one point, about 40 minutes into Ashby's portion, Vic asked, on the morning of the 14th, before contacting the sheriff's department, did you contact the software vendor? Ashby's answer came after a beat. No. Did you review the documented complaint history in your system before initiating the law enforcement referral? Another beat. I reviewed the audit report. The audit report that the software generated, Vic said, which identified a discrepancy without attributing cause. Yes. You were aware that staff complaints had been filed relating to the same system. Ashby looked at the table. I was. And you contacted law enforcement without first investigating whether those complaints might explain the discrepancy. The silence lasted 4 seconds. Yes, Ashby said. That's correct. Vic wrote something long. Then he looked up and addressed the room generally. For the record, the board finds that the controlled substance discrepancies were attributable entirely to third-party software malfunction. No staff member engaged in misconduct. The investigation of Nurse Bennett was initiated without exhaustion of internal remediation steps as required by facility protocol, and the communication of unverified investigative information to staff during the investigation constitutes an additional procedural violation. He closed his folder. Director Ashby will be required to complete a mandatory remediation program and submit to a 6-month supervisory review period. IT Director Garland will be required to implement and document a functional escalation flag system within 30 days, subject to board verification. He paused. The board is also referring this facility's complaint handling records to the Regional Oversight Committee for inclusion in a broader protocol review. The case will be used as a training example. He looked at Claire. Nurse Bennett, the board formally acknowledges that you followed correct procedure throughout. Your documentation was exemplary. The failure was systemic, not individual. He paused. We're sorry it took this form. Claire looked at him for a moment. Thank you, she said. It was the same thing she'd said to Holt the day before. It wasn't performance. It was just the accurate response. The thing that needed to be said without decoration. The meeting ended at 11:40. People filed out. Garland left quickly. Ashby stayed seated for a moment after everyone else had moved, looking at his notes, and Claire passed him on her way to the door and didn't stop. There was nothing useful she could say to him right now, and she wasn't going to say something useless just to fill the space. Outside in the corridor, Calloway fell into step beside her. Satisfying? He said. Not the right word, she said. What's the right word? She thought about it. Correct, she said. It was correct. He nodded. That seemed to fit for him too. Voss caught up to her near the lobby. Falcone was already on her phone, probably updating the county file. He looked like a man who'd just watched something complicated resolve itself and was still processing the resolution. The county report closes today, he said. Final version. If you want a copy, I want a copy, she said. I'll send it this afternoon. He paused. The case study for the Nursing Association. Ferris also contacted me this morning, separately. She said the IG's office may want to include your documentation timeline in their administrative audit findings. As an example of how to build a complaint record in a system that isn't responsive, he paused. You'd be a good example in about 4 different contexts right now. I know, she said. How are you feeling about that? She looked at him. Ask me after Kellerton, she said. The meeting with Lieutenant Colonel Ferris happened 2 days later, on a Thursday morning, in a beige conference room in the Kellerton Administrative Building that smelled like institutional carpet and recycled air. Ferris was 52, compact, with the posture of someone who'd been military for so long it had become structural. She had a thin folder on the table in front of her and a thicker one to the side that she didn't open until she'd shaken Claire's hand and they'd both sat down. The meeting took 2 hours and 20 minutes. Most of it was documentation, forms, acknowledgments, records to be signed and co-signed and dated. The correction order striking the zone violation finding from Claire's separation record. The reclassification paperwork changing her separation status from disciplinary to medical, full honors. A supplemental commendation form that Ferris slid across the table with the air of someone delivering something that should have been delivered a long time ago. This was also part of the review board's recommendation, Ferris said. It was held with the other documents. Claire looked at it. A formal commendation for the extraction response. The specific language citing her actions during the incident, the lives preserved, the conditions under which she'd acted, her service designation at the top, her name. Her name, in a commendation document that had been sitting in a personnel command office for 6 years. She signed everything. She co-signed everything. She took the copies Ferris provided and she put them in the folder she'd brought, and she sat with her hands flat on the table for a moment before she stood up. Is there anything else? She said. Ferris looked at her with the particular expression of someone who understood that the words "is there anything else" were doing a lot of work in that sentence. There will be a formal notification sent to your previous unit command, she said, and a correction filed with the National Personnel Record. Within 60 days, the reclassification should be reflected in all relevant systems. She paused. If there are any delays, contact me directly. I will, Claire said. She drove back to Gray Mill. She did not stop anywhere on the way. She went to work because she had a shift at noon, and the animals in her care had not stopped needing their medications and their monitoring and their post-surgical checks because her record was being corrected. She was halfway through the afternoon rounds when Calloway texted. Ferris sent me the notification. It processed. Congratulations seems wrong, but I don't have a better word. She texted back. It's fine. Thank you for filing the complaint. A pause. Then, I should have done more to follow up. Yes, she wrote. But you started it. That counts. She put the phone back in her pocket. She checked the temperature on a post-op retriever, updated the chart, moved to the next enclosure. At 4:30, the front desk paged her. She picked up the internal line. There's someone here to see you, the receptionist said. He says his name is Marcus Webb. He has recon with him. A pause. And there are two other people with him. I don't have names, but one of them is in a uniform and the other one has a lot of paperwork. Claire set down the chart. Send them back, she said. She walked to the hallway junction and waited, and she heard recon before she saw him. The particular sound of his paws on the tile, slightly uneven now, favoring the repaired leg, but moving. Coming down the hallway with the same purposeful direction he'd had 4 days ago when he'd come through the lobby and found her in the break room. He came around the corner. He saw her. His tail moved, not twice this time, but continuously, the full-body movement of a dog who has found the thing he was looking for and intends to make that fact clearly known. Webb was behind him, and Calloway behind Webb, and behind Calloway was a woman in a dress uniform that Claire recognized as 3rd Medical Command insignia, and the woman had a folder under her arm that was not the same folder Ferris had given her 2 days ago. It was thicker. Claire looked at the folder. She looked at Webb. She looked at Calloway, who had the expression of a man who'd made one more phone call than he'd told her about. What is that? She said. Calloway said, there was a second commendation. She looked at him. From Webb's handler chain, he said, filed at the same time, different command office. I found out about it when I was following up on the IG audit. He paused. It was also not processed. The woman in the uniform stepped forward. Nurse Bennett, she said, and her voice was formal and unhurried. My name is Major Sylvia Okafor, 3rd Medical Command Honors Division. I've been asked to deliver this in person. She held out the folder. There's a review board finding and a commendation and a correction order, all requiring your signature. She paused. And an apology. From the command. In writing, because I was told you appreciate documentation. The hallway was very quiet. Claire looked at the folder. She looked at Recon, who was now sitting at her feet with his head tilted up toward her, tail still moving. She took the folder. She opened it. And there, on the first page, above the command seal and the formal language and the signature lines, was a line she read 3 times before she believed it. Subject: correction and recognition. Commendation for valor under fire. Her hands, the ones with the nerve damage, the ones that trembled when she was cold or tired or under sustained pressure, were completely still. She turned to the second page, and then to the third. The third page was not a commendation form, it was a letter, on official command letterhead, addressed to her by name, and it did not begin with formal language. It began with 5 words that no one in any official capacity had ever said to her about the incident, not in 7 years, not in any debrief or separation proceeding or personnel communication she'd ever received. We should have done better. She stood in the hallway and read the letter twice. Not because she hadn't understood it the first time, she'd understood it immediately. The language was plain, direct, written by someone who had made a deliberate choice not to hide behind formal phrasing. She read it twice because she needed the second pass to confirm that it was real, that the words were what they were, that she wasn't filling in what she wanted to see in the space of what was actually printed. We should have done better. Then, the review board's findings make clear that your actions during the extraction event were consistent with your training, your standing orders, and your character as a medical professional. The zone violation determination was an administrative error made under pressure and without full consideration of the operational timeline. It should not have defined your record. It will not continue to do so. Recon was still sitting at her feet. His tail had slowed to an intermittent movement, patient, steady, the rhythm of an animal that had been waiting a long time for something and had found it and was in no hurry to leave. Major Okafor was watching Claire with the expression of someone who'd delivered difficult things in official capacities for long enough to understand when to be quiet and let the moment be what it was. Calloway was looking at the floor. Webb had his arms crossed, not defensively. The posture of someone holding himself together around something that was larger than the space he was standing in. Claire turned to the 4th page. Signature lines, date fields. A place for her printed name and one for her initials on each of 3 subsections. She read each subsection carefully because she always read things carefully, because that was the habit she'd built in the years since she'd learned what happened when documentation wasn't treated as the serious thing it was. She initialed each one. She signed the bottom. She printed her name in block letters that were slightly less steady than usual, which she noticed and did not comment on. She handed the folder back to Major Okafor. "How long for the record to update?" she said. 60 days for the national file, Okafor said. "The unit command notification processes within the week. I'll send you confirmation of each step." "Thank you," Claire said. Okafor nodded once. She tucked the folder under her arm, shook Claire's hand with the firm brevity of someone who respected other people's need to process things privately, and walked back toward the lobby. The hallway was quieter without her. Calloway looked up. "I found out about the second commendation file 4 days ago," he said. "Right before the board meeting. I didn't tell you because I wasn't certain it would process, and I didn't want to—" He stopped. "I didn't want to add to what was already a significant amount of information." "I understand," Claire said. "That's not— You don't have to let me off the hook for timing." "I'm not letting you off the hook," she said. "I'm saying I understand the decision." She looked at him. "That's different." He accepted that without pushing on it, which was the right call. She looked down at Recon. He looked back up at her. The surgical site on his abdomen was healing well. She could see where the shaved area was beginning to show new growth, the skin underneath clean and closed. He was standing on all 4 legs, the rear left slightly favored but bearing weight. He was doing what dogs did after they survived something, moving forward, without retrospect, because retrospect was a human habit and Recon had never had much use for it. "He needs his 2-week follow-up," she said to Webb. Webb's mouth moved into something that was almost a smile. "I know," he said. "I was going to call." "Call the main line, ask for Dr. Ewan. She'll set it up." She paused. "Tell her I said his appetite should be fully normalized by then. If it isn't, she'll want to know." "Okay." She crouched down, slowly, carefully, the way she always had to with the brace and the joint, and she put both hands on either side of Recon's face. He let her. He leaned into it slightly, the way he'd leaned against her leg in the break room 6 days ago, and she looked at him for a moment with the specific attention she gave to things she wanted to remember accurately, not sentimentally. "Good boy," she said quietly. "You're going to be fine." His tail moved. She straightened. She looked at Webb, and then at Calloway, and then at the hallway behind them that led back to the main floor, and the monitoring charts, and the afternoon rounds that were still waiting. "I have to get back to work," she said. The pharmacy board's formal report published 3 weeks later. It was a public document, standard procedure for board findings, available through the Regional Health Authority's online portal, and it was 11 pages long, which was longer than most board reports of its type. The first 6 pages covered the technical findings, the software defect, the vendor's acknowledgement, the remediation timeline, and the facility's corrective action plan. The 7th page began the accountability section, and it was the 7th page that investigator Dorian Voss read twice in his office on the morning the report went live, with his second cup of coffee cooling beside his keyboard. The accountability section named Garrett Ashby by title, not by name, as board reports typically anonymized individuals, as facility director and outlined the specific procedural failures. Failure to escalate 2 documented staff complaints, failure to conduct internal remediation prior to law enforcement referral, and failure to ensure accurate communication of investigative status to staff. The mandatory remediation program and 6-month supervisory review were listed as the imposed consequences, along with a requirement for facility-wide retraining on complaint escalation protocols within 90 days. Pete Garland appeared as IT director on the following page. His failures were documented with similar precision. Failure to action a software complaint within the mandated 72-hour window, failure to flag a recurring complaint for escalation, and failure to verify the functionality of the escalation flag system. His consequence was the 30-day implementation deadline, board verified, with a notation that failure to comply would result in a secondary review with potential licensing implications for the facility. The 9th page was titled Best Practices Identified. It was the page that got shared most widely, first among regional veterinary nursing staff, and then more broadly, because it was written in unusually direct language for a board document, and because the practices it outlined were presented not as abstract recommendations, but as a specific case study drawn from documented events. It described, without naming her, a staff member who had identified a software malfunction, filed 3 documented complaints through appropriate channels within a 30-day period, maintained personal copies of all filings, requested written documentation when asked to step back from duties during an investigation, and had maintained a time-stamped record of all significant interactions related to the complaint from the first report through the investigation's conclusion. The board noted that this documentation had been decisive in establishing the timeline of events and had protected the staff member from adverse professional findings. Thorough self-documentation in the face of unresponsive systems is not a failure of process, the report read. It is an adaptation to one. Staff members facing recurring non-response should treat personal documentation as professional self-defense. The Regional Veterinary Nursing Association requested permission to include the case study in their annual training materials. The board granted it. By the time the training cycle began the following quarter, Claire's documentation practices, still attributed only to the staff member, were being discussed in continuing education modules in 4 counties. She found out about it from a nursing student at Gray Mill Community College, who stopped her in the parking lot of a grocery store, having recognized her from a staff photo on the Harlow website. "Is it true you're the case study?" the student asked. She was maybe 22, with the particular intensity of someone in the middle of a program that was harder than they'd expected. "Yes," Claire said. "Can I ask you something?" "Go ahead." "Were you scared?" The student said it like it had been sitting in her chest for a while. "When they were investigating you and nobody was listening and the evidence was right there but nobody was looking at it, were you scared it wouldn't work out?" Claire thought about it honestly. "Yes," she said, "but being scared and continuing to do the right thing aren't mutually exclusive." She shifted her grocery bag to her other arm. "The documentation wasn't a strategy. I documented because documentation was the correct process. I was just meticulous about it because I'd learned, the hard way, that being correct isn't always enough. You also have to be able to prove it." The student looked at her with an expression that was somewhere between relief and recognition. The look of someone who'd needed to hear exactly that and hadn't known it until they heard it. "Thank you," she said. "What's your name?" Claire said. "Priya." "Good luck, Priya," she said. "Document everything." Garrett Ashby began his remediation program in the 4th week after the board report published. He attended the first session alone, which he'd been given the option not to do. The program offered cohort scheduling. But he'd chosen the individual track, which the board's remediation coordinator told him later was unusual and, in her experience, indicated someone who had made a genuine decision to take it seriously rather than complete it. The program was 8 weeks. It covered complaint escalation protocols, internal investigation procedures, communication standards during active reviews, and a module specifically developed after the Harlow case on the distinction between initiating law enforcement referrals and internal remediation. Ashby completed all 8 sessions. He submitted his written reflection assignments on time. His supervisory review period began in week 9. He was not a bad man. He had made bad decisions quickly, without enough information, and then compounded them by not correcting course when correction was still relatively inexpensive. The board's consequence was proportionate, and he knew it was proportionate, which was part of what made the 8 weeks harder than they might otherwise have been. In his week 4 reflection assignment, which the coordinator did not share with anyone because reflection assignments were confidential, he wrote about the staff meeting he'd held on the morning of the investigation, the one where he'd used the word personnel without clarifying what he meant, and watched a room full of people fill in the blank he'd left. He wrote that he hadn't realized until later how much damage an imprecise word in an authority position could do. He wrote that he'd been managing a situation and had stopped in those moments, managing it as something that was happening to another person, and had started managing it as something that was happening to his facility. He wrote that this was a failure of both process and of basic human attention, and that the two were not as separable as he'd previously believed. He signed the reflection with his name. He submitted it. He moved on to week 5. Pete Garland implemented the escalation flag system in 26 days, 4 days before his deadline. He sent the verification documentation to the board without prompting. He also, quietly and without announcement, drafted a new internal protocol for his department requiring that any staff complaint involving patient-adjacent systems, medication dispensing, monitoring equipment, IV pumps, be flagged for same-day review regardless of queue position. He didn't tell anyone he'd done it. It just appeared in the department handbook in the revision published that month, and the IT team noted it and updated their procedures accordingly. It was not an apology, but it was a correction, and corrections that get implemented are worth more than apologies that don't. Recon's 2-week follow-up happened on a Wednesday afternoon. Dr. Ewan did the examination with the unhurried thoroughness she applied to all her post-surgical assessments, checking the incision site, palpating the abdomen, watching him walk a short circuit of the exam room to assess his gait on the repaired leg. He was moving better than she'd expected. Not perfectly. The rear left would always carry the history of what had happened to it, both in the field 7 years ago and in the OR 2 weeks ago. But functionally, sustainably, with the characteristic forward momentum of a dog who had not received the memo about slowing down. Claire was in the room because she'd been there when Webb texted that they were in the parking lot, and she'd gone to meet them, which was technically not within her assigned duties for that shift, but Ewan had waved it through without discussion. Weight bearing is good, Ewan said, watching Recon's circuit. Incision is clean. Appetite back to normal? Since day 4, Webb said. Good. We'll keep the dietary restriction. Smaller meals, slow feeder. That's permanent now. GDV risk once is GDV risk ongoing. She looked at Recon, who had stopped his circuit and was sitting next to Claire with the settled confidence of an animal that had decided where it belonged in a room. Emotionally, he seems stable. He's been better, Webb said. Since the surgery. Calmer. He paused. I think he was in more pain than we knew. Working dogs generally are, Ewan said. They're trained not to signal it. She made a notation in the chart. He can resume light activity. Walks, gentle exercise, no running for another 3 weeks. After that, reassess. She handed the chart to the tech and looked at Claire. You doing his follow-ons? If Webb requests me specifically, yes, Claire said. Otherwise, whoever's on rotation. Request you specifically, Ewan said to Webb. Webb looked slightly startled at the directness of it. Okay, he said. She has the best baseline on him now, Ewan said, already moving toward the door. Makes the monitoring more accurate. She paused at the door. Also, he behaves better when she's in the room, which saves everyone time. She left. Webb looked at Recon, who was demonstrably sitting very still and very calmly next to Claire, in a way he had not been sitting during the examination until Claire had come to stand beside him. She's not wrong, Webb said. No, Claire said. She crouched down and checked the incision site herself. Not because Ewan had missed anything, but because she'd been monitoring it, and she wanted the continuity of her own assessment. The healing was good. The skin was clean, and the suture line was integrating properly, and the shaved area around it was showing the early soft growth of recovery. She put her hand briefly on his side, feeling his breathing, even, full, unlabored. He turned his head and touched his nose to her wrist. She stayed crouched for a moment. The nerve damage in her leg was doing its usual thing with prolonged crouching, a slow building pressure that would turn into a sharper complaint if she stayed down too long. And she straightened up before it got there smoothly, without comment. Webb was watching. Not in the assessing way that some people watched her manage the leg, with pity, or with the particular awkward concern of people who didn't know what to do with someone else's permanent limitation. I was watching the way people watch things they've had time to understand and have stopped trying to fix. Calloway told me about Kellerton, he said, about the second commendation. I figured he would. I want you to know I didn't know about it, he said. The second one. I knew about the first. Calloway told me he'd filed it. The second one came from my handler chain, and I was still in recovery when it was filed. I didn't know until 4 days ago. I know, she said. I'm not holding you responsible for your chain of commands paperwork. Still, he said. Still, she agreed. They were quiet for a moment. Recon leaned against her leg. The left one, the damaged one, the one he'd found by instinct the first time and had returned to every time since, as if he'd made a decision about it that didn't require any further deliberation. I want to ask you something, Webb said, and you can say no. Ask. There's a veteran support program, he said, outside Gray Mill, animal assisted, runs on Saturday mornings. They work with retired working dogs and veterans dealing with readjustment issues. They've been looking for a medical staff member with both clinical experience and veteran background. He paused. Someone mentioned your name before any of this happened, someone who knew you from your humanitarian unit. I have their contact if you want it. Claire looked at him. Who mentioned my name? A medic named Darla Swick. She said she served adjacent to your unit for about 4 months. She said you were the most organized person under pressure she'd ever worked with, and that if she was ever in a bad situation, she'd want you in the room. Claire thought for a moment. Darla Swick. Red hair, fast talker, able to perform a pressure dressing one-handed while arguing about something entirely unrelated. I remember her, she said. She runs the Saturday program, Webb said. She's been asking around for 18 months for the right person. I told her after this week that I thought she'd found them. He paused. You don't have to decide now. Claire looked at Recon. He was looking up at her with the patient, undemanding attention of an animal who had long since stopped requiring anything from her except her presence, which he had now, and that was enough. Give me her number, she said. The conversation with Darla Swick lasted 45 minutes and covered, in roughly equal parts, the operational structure of the Saturday program, the specific needs of the veteran population it served, the particular challenges of working with retired military dogs who had readjustment issues of their own, and approximately 8 minutes of the two of them remembering a specific afternoon in a field station that had involved a broken sterilizer, a sandstorm, and a medical supply delivery that had included 12 boxes of the wrong size gloves. I cannot believe you remember the gloves, Darla said. I had to split them into pairs and redistribute them across 6 stations, Claire said. I remember the gloves. We were improvising for 3 days. 4, Claire said. The replacement order took longer than it should have. It always did. A pause, and the quality of the silence changed slightly. How are you? Darla said. Not the conversational version of the question, the real one. Better than last week, Claire said. Better than last year. She paused. Working on it. That's all it is, Darla said. Just working on it. She paused. We could use you on Saturdays, genuinely. Not as a favor. The program needs what you have. I know, Claire said. I want to do it. Yeah? Yeah, she said. She started the following Saturday. The program operated out of a community center in a neighborhood east of downtown Graymill, a repurposed gymnasium with good light and a fenced outdoor area large enough for dogs to move freely. There were 12 veterans in the current cohort, ranging from 23 to 61 at various stages of various transitions. There were 4 dogs, all retired from service of different kinds. 1 former police canine, 1 search and rescue dog who'd worked disaster response, 1 military working dog whose service record Claire read briefly and set aside, and Recon, who Webb had brought for the first session with the specific question of whether the structured environment might help with what Ewan had called his readjustment anxiety. It did. Within 20 minutes of the first session, Recon had appointed himself a kind of unofficial ambassador to the 3 veterans who were most visibly uncomfortable in the space, not performing, not working in the trained sense, just moving toward the people who were sitting at the edges of the room and sitting near them with the low-key, deliberate presence of an animal that understood something about edges and the people who occupied them. One of the veterans, a 26-year-old named Tobias, who had not spoken in the first session's opening circle, put his hand on Recon's head at the 40-minute mark. He didn't say anything, but he stayed for the rest of the session, which Darla told Claire afterward was the first time he'd stayed for a full session in 3 weeks. Claire ran the medical component, monitoring, basic health checks for the dogs, and a standing consultation for any veterans with physical health concerns they hadn't gotten around to addressing through other channels. It was not glamorous work. It involved a lot of paperwork and occasional awkward conversations, and the particular challenge of working with people who had learned, in the same training environment she had, that admitting physical pain was a weakness and had not yet fully unlearned it. She was good at it. Not because she was effortlessly skilled. She made mistakes, she misjudged situations, she had sessions where she left feeling like she'd moved things sideways instead of forward. She was good at it because she kept showing up and because she understood, from the inside of it, what it felt like to be in a body that had been through something it couldn't ungo through, and to still have to function in a world that didn't particularly account for that. She never talked about her own record in the sessions. It wasn't the point. But she didn't hide the brace or the limp or the hand that sometimes tremored when she was tired, because visibility was its own kind of information. And the veterans in that room had spent enough time around people who performed wellness to recognize someone who wasn't performing. Tobias, in his third session, asked her what happened to her leg. She told him. Not everything. The operational details weren't hers to share and weren't his to need. But the shape of it. The explosion, the surgeries, the separation, the years of building something workable in the space of what was left. Does it still hurt? He said. Every day, she said. But you're here. But I'm here, she said. He was quiet for a moment. I don't know how to do that, he said. Keep going when something still hurts. You do it badly for a while, she said, and then slightly less badly. And then one day you realize the hurt is still there, but it stopped being the thing that determines what you do. She paused. It takes longer than anyone tells you it will. He looked at her with the expression of someone who'd needed to hear that it took a long time, specifically, not that it got better, not that it was worth it, but that it was going to take a long time, and that was normal and not a sign of failure. Okay, he said. Okay, she said. 2 months after the Pharmacy Board report published, the Regional Oversight Committee finalized its broader protocol review. The review had been initiated as a result of the Harlow case and covered complaint handling procedures across 23 veterinary and medical facilities in the region. It found similar gaps in 7 of them, not as severe as Harlow's, but structural weaknesses in escalation protocols that the committee determined created conditions for the same kind of failure. Mandatory protocol updates were issued to all 23 facilities. The Harlow case was cited as the catalyst in the committee's preamble. The Pharmacy Board's training division published the full case study, no longer anonymized because Claire had given consent, in their quarterly continuing education module. The module was titled Documentation as Protection, a case study in self-advocacy within unresponsive systems. It was assigned to nursing staff at 91 facilities in the first distribution cycle. Voss read the module when Falcone forwarded it to him. He read it in his office on a Thursday afternoon and didn't say anything about it to anyone, but he sat with it for a while after closing the document, thinking about the kitchen at Harlow, where he'd watched Claire Bennett set down a cup of coffee and tell him the tremor in her hand wasn't nerves, about the way she'd said it, not asking him to believe her, just stating what was true and leaving it there for him to do whatever he did with it. He'd gotten it wrong and then he'd followed the evidence and gotten it right, and the getting it right had mattered, but so had the getting it wrong. And he thought that was probably the more honest takeaway from the whole morning than the satisfying version where good process inevitably leads to good outcomes. Good process had helped, but so had a retired military dog that had walked through 2 sets of double doors. So had a federal contractor sitting in a county break room and saying, "Sit down," to a hospital director. So had Falcone's block capital notation on a tablet. She was right, all 3 times. Systems didn't work because they were good systems. They worked because people inside them kept pushing on them. He thought about that. He thought it was worth thinking about. He closed his computer and went home. The following spring, Harlow Emergency Animal Hospital announced the opening of a small rehabilitative garden on the facility's south side, a fenced outdoor area with accessible paths, weather-appropriate seating, and a separate enclosed section designed for animals in post-surgical or behavioral recovery. The garden had been partly funded by a regional veterans advocacy organization and partly by a private donation that Claire had not solicited and had found out about only when Calloway told her, with the slightly guilty expression of a man who had done something without asking and knew it. "You didn't have to do that," she said. "I know," he said. "I wanted to." "It's too much." "It's a garden," he said. "It has benches." She looked at him. "Don't do things without asking," she said. "I'm aware," he said. "I'm working on it." The opening ceremony was a small event. Facility staff, a few board representatives, Darla Swick, and several veterans from the Saturday program, Voss and Falcone in civilian clothes, Webb with recon on a loose lead. The weather was good. Someone had set out chairs in a semicircle around the ribbon. A local official said brief words. Ashby spoke for 3 minutes about the facility's commitment to doing better, which was not the most comfortable 3 minutes he'd experienced recently, but which he got through without flinching, and which Claire thought showed something about the 8 weeks of remediation that she hadn't entirely expected. Darla had told her, the week before, that the Saturday program was applying for a formal funding grant and needed a clinical lead named on the application. "Your name," Darla said. "You don't need my name," Claire said. "You need qualifications." "Your qualifications are on the commendation documents," Darla said, "which are now part of the public record, which means I can cite them." She paused. "Let me put your name on it." "Fine," Claire said. "That took less arguing than I expected." "I'm tired of arguing with things that make sense," Claire said. The grant came through 6 weeks later. At the garden opening, someone asked Claire to say a few words, which she hadn't expected and would have declined if the person asking hadn't been Priya, the nursing student from the grocery store parking lot who had apparently tracked down the event and shown up in her hospital placement scrubs with a small notebook and the expression of someone who'd made a deliberate decision to be somewhere. Claire looked at the assembled group. She was not a speaker. She didn't particularly want to be one. But Priya was looking at her with the specific attention of someone for whom this moment was going to mean something, and she thought about what she would have wanted to hear 7 years ago, standing in a corridor being handed her medical separation paperwork with a damaged leg and a commendation that was in the process of getting lost in a filing system. "I'm not going to say this was worth it," she said, "because I don't think pain has to justify itself by producing something useful. It happens, and you deal with it, and sometimes dealing with it turns into something that helps other people, and that's good. But the pain doesn't need to have been worth it for that to be true." She paused. "What I'll say is this. I documented everything. I followed the correct process even when nobody was responding to it. I kept working when the situation told me to stop. Not because I was brave. I wasn't brave, I was scared and exhausted, and my leg hurt, and I had been awake for 20 hours. She looked at the group. "I kept working because the work was real, and the animals needed it, and I had not done anything wrong. That was enough. It turned out to be enough." She stopped. "Document everything. Know your procedures. Don't let the noise of a bad moment convince you that you are the problem. And if you have to stand in a room full of people who have decided what you are before they've looked at the evidence," she paused, "let them look. Because the evidence is the thing that doesn't change." There was a moment of quiet after she finished. Then Darla started clapping, which was the kind of clapping that gave everyone else permission, and the rest of the group joined. Claire stepped back from the ribbon. She looked for Recon. He was beside Webb, 6 feet away, already watching her. His tail moved when their eyes met. The same 2-beat movement he'd had in the break room on the worst morning of the past 7 years. The movement that had meant "I know you" before anyone else in the room had known anything at all. She crossed to him. She put her hand on the back of his neck, and he leaned into it, and she stood there in the good spring light with her repaired and damaged body and her corrected record, and her Saturday mornings, and her documentation practices, and her nursing station, and her permanent leg brace, and the nerve damage that flared when she was cold or tired or under pressure, which was often. Calloway came to stand beside her. He didn't say anything immediately. Webb was looking at the garden. "It's good," he said. "What you said." "It's what I know," she said. "That's what made it good," he said. Calloway looked at her from the side. He had the expression of a man who had filed a complaint on her behalf 14 months after an explosion in a country he couldn't name, and then failed to follow up for 6 years, and had been living with the weight of that in a specific compartment of himself ever since. There were 10 things I should have done differently," he said. "Over the years." "Bryce," she said. "I'm not looking for absolution," he said. "I know," she said. "But you did start it. You filed the complaint. You found me in Gray Mill. You walked into Harlow with Recon and changed the shape of that morning." She looked at him. "It wasn't the perfect sequence of decisions." "No," he said. "But it got here," she said. "We're here." He was quiet for a moment. "We're here," he said. Recon moved under Claire's hand, adjusting his weight, the rear leg taking it steadily. He was not the dog he'd been before the surgery, not entirely, and he was not the dog he'd been in the field before that, not even close. He was the dog he was now. 8 years old, gray at the muzzle, a surgical scar on his abdomen, and an older scar on his rear leg, and the collected experience of everything that had happened to him written into the way he moved. He was not the version of himself from any particular point in the past. He was all of it, assembled into the present moment, standing in a garden in the spring, with his head against the hand of the woman who had kept him alive when keeping him alive had cost her something permanent. He seemed, as far as anyone could tell, to think this was a reasonable outcome. Claire thought so too. Not because it was the outcome she would have designed, or the timeline she would have chosen, or the process she would have wished on anyone. Because being right doesn't protect you from being doubted, and doing your job correctly doesn't prevent someone from calling the sheriff's department at 5 in the morning, and following the rules is not a guarantee that the rules will work the way they're supposed to work. She knew all of that. She'd learned it in ways that had left marks. But she also knew this. The records existed. The documentation was in the file. The evidence had been there the whole time, waiting to be followed by someone willing to follow it. She had built, over years, and without knowing exactly why she was being so meticulous about it, the precise architecture of her own vindication. Not because she'd anticipated needing it, but because correct process was the thing she knew how to do, and she had kept doing it even when the system wasn't responding and nobody was looking, and the easiest thing in the world would have been to stop. That was the part she wanted Priya to carry out of this day. Not the commendation, not the garden, not the satisfying sequence of a board report and an accountability review and a case study and a continuing education module. The part before all of that. The part where you're alone in a break room and your leg hurts, and the investigation is ongoing and the path forward is just to keep doing the thing correctly because it's correct, and you don't know yet whether that's going to be enough, and you do it anyway. That was the whole lesson. Everything else was just what happened after. She stood in the garden with her hand on Recon's neck and the spring light on her face and the sound of people around her who had all, in their different ways and on their different timelines, ended up in the same place. The place where the work had been worth doing and the standing had been worth the cost, and the damage was real and permanent, and also not the final word. Not the final word. That was the thing about showing up. Every time you did it, you got to write a little more of what came next. And Claire Bennett intended for a very long time to keep writing. Darshmin,